morning, everybody. Happy Saturday. I'm well in here. Yes, a little chilly outside. So you guys are all writing the case study PLAR as the idea here, right? So today we're going to focus on case studies. Before we actually go into them, and we have plenty of cases to go through if we need to, this is just a little introduction to talk about the way that we generally analyze case studies and compose the treatment plan or treatment principle, treatment plan, and treatment point selection, things like this. So if you had a chance to look over it, great. If not, that's okay. When you're doing an exam, you're not going to be gathering information, right? You're being presented information on a piece of paper. There may be some information missing. So for example, normally we have the patient information and demographics, right? We normally have the chief complaint. We normally have the comprehensive signs and symptoms, subjective and objective, including tongue and pulse. However, when you're doing the case, you may not have some of it. So if, for example, you rely too much on the chief complaint, you may miss something that comes in the tongue and pulse. Or if you rely too much on tongue and pulse, they may not give you the tongue and pulse, and they're expecting you to have further knowledge on signs and symptoms and how to form a diagnosis based on that. Well beyond the scope of today to go into what all of that means. But so in terms of diagnosis, we're presented with whatever information we are. We're analyzing that information. We're looking for a diagnosis, right? And the college defines a diagnosis as including both the TCM disease or illness and the TCM pattern, right? So there's we said last week, eczema or something like this. What is the cause of the eczema according to TCM? One of the scope of practice for TCM includes the ability to diagnose and treat based on TCM, the TCM paradigm, understanding, right? Good morning. So the diagnosis or a comprehensive diagnosis should include both, all right? The disease or illness and the syndrome or pattern. Syndrome, differentiation, or pattern. Clear? Good. Question? Yeah, so, okay. Okay. Yeah. Okay. So I have to repeat that question, so try and keep your questions, for the people online, so try and keep your questions concise. So the question is the first thing that is written down in a case usually weighted higher than other information that is written after? And I would say yes. Generally speaking, we have to assume that whoever wrote the case down, when we're talking about signs and symptoms, female presents with lower back pain or knee, arthritis of the hips, that is the main complaint that they have if it's not otherwise specified. In terms of weightedness of the tongue and pulse, this is a little bit trickier. So, the tongue and the pulse generally should be, this in TCM accounts for objective information rather than subjective. So very often you are expected to be able to rely on the tongue and pulse to verify your pattern differentiation. Does that make sense? If you're going through a case and you think, oh, this is, damp heat, damp heat, damp heat, you get to the tongue and it's pale, bluish with a white, greasy coating, and the pulse is slippery and deep, you better rethink that diagnosis. Okay? So, anyways, in terms of, can everybody see this okay? It's okay, right? So in terms of the case studies themselves, this is, we're starting here. We're starting with TCM diagnosis and treatment, right? First, we're writing the diagnosis. Second thing is we're writing the treatment principle. The treatment principle in general should be exactly what the diagnosis is backwards. So if it's damp heat B, the treatment principle would be resolve damp heat. We may include something like, so if it's B syndrome, it's a painful obstruction syndrome. We may include stop pain as part of the treatment principle. So we could say resolve damp heat B syndrome, or wind damp heat from the joints, and stop pain. Some, if we're intentionally, if that's part of the chief complaint. But generally, the treatment principle should mirror whatever your diagnosis is. If we say this is a kidney yang deficiency, the treatment principle would be tonify kidney yang. If the chief complaint is frequent urination, then we may add stop frequent urination, or astringe, the urine, right? Strengthen, so the treatment principle would be to tonify kidney yang and stop urination. Make sense? So for example, in that case, let's use this as an example. If somebody has a kidney yang deficiency, we know that we could have frequent urination and incontinence. I may add the acupuncture point Ren 3, because it's the front move point of the urinary bladder, if the chief complaint is the incontinence. I may also add Ren 4, which has a more effect on the kidney, but because I'm choosing a point specifically because of the chief complaint. Make sense? We'll talk a little bit more about that in a second. So the treatment plan itself, most of you are doing acupuncture, but I would also like to talk a little bit. There's two things I want to talk about. One is lifestyle counseling, if necessary, diet, things like this. And specifically, I'll spend a little bit more time, because last week some of you had some questions on treatment plans, and I found some information, some kind of like standardized information of like acute, subacute, chronic conditions, how frequently, and how long. So I have to pull that up, but yeah, we'll talk about that a little bit later. Okay, considerations in the case now. So these are, kind of personal, I don't know, from teaching cases and from working in student clinic, things that I think that are relevant to helping people understand case analysis specifically. We may be given information on the cause of the disease. So in TCM, we have information on, what we say the 6 evils, 7 emotions, or 5 miscellaneous factors. So for example, disease could be caused by trauma, or it could be caused by diet, or it could be caused by exterior pathogen invading the body, right? These are possible causes. The cause of the disease gives us information about the nature of the disease. So if it was caused by wind cold, we know something about that. However, it doesn't tell us what the current diagnosis is. So you always have to separate the cause from the pattern. The cause informs our understanding, but it is not always the diagnosis now. So basically, clearly when you're going through a case, clearly try to separate the timeline. It started with this, and now they have this. Does that make sense? Or, yeah? Okay. Everybody online? Okay. Illness. The illness or the disease or the, WHO uses disorder, right? Like a traditional medicine disorder. Illness is what is listed, in the, CTCM PAO list of conditions we're expected to treat. So that's why I'm using it here. Question is, what is the most appropriate illness? Often it is very, very closely related to the chief complaint. Most of the time it should be related to the chief complaint. Sometimes you may have to choose, in the rare situation, it may not be related to the chief complaint, but you should be able to identify all of the diseases based on the signs and symptoms rather than the name of the illness. So, if we talk about eczema, or, I used the example last week, I think I put up, didn't I put up a case of tinea, right? And so, we didn't actually cover that in the course, but it's, you were expected to identify this coin-shaped skin lesion, in this area of the body as tinea, as opposed, without being told that. So, one of my suggestions is basically go through the list of illnesses and make sure you understand what each of those illnesses are, especially language, terminology. If you don't know what, dysuria is or something like this, then make sure you do. Make sure you know the definitions of the terminologies that are listed. Okay. So, when we go through, we often see the illness or as presented as a chief complaint or somewhere up there. Then we're going through the signs and symptoms, and in our TCM frame of mind, we're saying what caused this illness? Why do they have these signs and symptoms? Why does this patient have frequent urination and incontinence? So we're gathering as much information as we can, and we're trying to say basically what is the pattern? What is the primary pattern? So I have most of the time, in fact very often in case studies, you only have one pattern, right? So in like a written case study, many times you only have one pattern, one diagnosis that is causing the disease. Sometimes you have a secondary pattern. The primary pattern is generally, will most of the time match the disease. So, you're expected to answer the patient, why do you have frequent, the patient asks you, why do I have frequent urination? Can you explain to them why? Okay, let's say that they have, kidney yang deficiency, but they also have phlegm damp accumulation, right? So they come to you for frequent urination, but upon inquiry, when you look at all the signs and symptoms, they also have cough with profuse white sputum and a feeling of oppression of the chest and shortness of breath. It's not their chief complaint, but it is present in their pattern. So, the patient says, so in this case, which is the primary pattern, the kidney yang deficiency or the phlegm damp accumulation? The patient is asking you, why do I have frequent urination? The primary pattern matches the illness here. The phlegm damp accumulation is not the cause of frequent urination. The kidney yang deficiency is. The kidney yang deficiency is likely the cause of the phlegm damp accumulation because the kidney supplies the yang to the spleen, and then when the kidney yang is weak, the spleen may be weak, and then we accumulate phlegm damp. So there's a TCM rationale of why the kidney yang deficiency could lead to the phlegm damp accumulation, not so much the other way around in that situation. So we'd say, oh, this is the primary pattern, this is the secondary pattern. Question.
Or let's say frequent urination. What is related to prostatitis?
I don't want to answer questions like that because it just opens up a big book. The question is, if we have frequent urination, what is related to prostatitis, right? I mean, I don't want to answer disease questions today. There's no time for that, really. We can't say that. The whole point is we cannot say that prostatitis is due to one thing. Prostatitis may be caused by several different patterns. So unless you give a case study with signs and symptoms, then we can't answer what causes prostatitis. It's not always one thing, okay? This is the big, when we talk about traditional Chinese medicine, biomedicine, this is the big paradigm difference. We use a different paradigm. If you are a TCM practitioner and not a medical doctor or some other health profession that is using biomedical acupuncture versus TCM. If you use TCM, you have to have an understanding of TCM pathophysiology, right? This is, and we look at things differently. This is one of the reasons that we have some difficulty communicating, right? This is also the greatest strength of TCM, because we can address any disease in several different ways and make it appropriate to the patient and the individual. Okay? All right. So anyway, you'll get a better feel for this primary, secondary pattern when we get into the case studies. Basically, you're going to weigh everything. So, we go through and we say, well, what is the chief complaint? How many signs and symptoms? Let's say 70% of the signs and symptoms are one pattern, but then there's a few other signs and symptoms that kind of group together in a secondary pattern. All right? We want to be able to identify everything that's there. Ideally, our diagnosis can explain every sign and symptom that the patient has. It's all connected from our perspective. Okay? Pathogenesis, one root or two. So if there is one primary pattern, so in the example I use, a kidney yang deficiency, and we have a spleen deficiency with phlegm damp accumulation, this is really one root of two patterns, right? We have two, what we call Zhongfu patterns, two organ patterns, but we can say that both of these patterns are rooted in one. It's one cause. Sometimes, however, it may be two. So let's say we have a kidney yang deficiency, but they come in with cold and flu. They have, wind cold and an interior yang deficiency. These are two separate causes of disease. One is chronic interior deficiency of the energy of the body, and then one is an acute exterior invasion of pathogenic qi, xie qi, right? And then the last section here is treatment priority. We have to assess the treatment priority, is, again, most of the time related to their chief complaint, but in the example that I just gave, if a patient comes in with exterior patterns, generally get treated first, right? This mostly has to do with this balance between the body's resistive qi, upright qi, and the strength of the pathogenic qi. So in a nutshell, if the person's energy is strong, if they're not very, very deficient, then we will treat a pathogen first. We'll resolve the pathogen first and then strengthen anything that's weak after. If the patient is weak and they have a pathogen, then we may strengthen and resolve the pathogen simultaneously. All right? If they're so weak that we can't vent anything from the body, they're severely, severely deficient, we may need to tonify in order to expel the pathogen. It's a very basic idea there. Okay? Any questions so far? Does everybody feel fairly comfortable with what I'm talking about here? You say, I see a lot of straight faces like, I'm not sure. Okay, all right. We'll get a feel for it in a second here. Okay, so forming a TCM diagnosis. This is, I think that in many ways the diagnosis itself, it acts as the keystone for a case study. So the diagnosis is what connects the treatment itself to the signs and symptoms. The diagnosis explains the signs and symptoms that the patient has, and the diagnosis provides and informs your point selection, your treatment method, et cetera, et cetera. Okay? So a complete TCM diagnosis contains both the illness and the pattern or patterns. I've already talked about that. Ideally, it can explain all signs and symptoms that the patient has. In the very rare exception, you'll be presented with a case which has what we call a red herring or an outlier, which means that 95% of the symptoms are explained by the pattern, but then there's something that doesn't match. For example, everything says cold damp, but then they have a yellow tongue coating. And it's like, you have to kind of assess, but that's fairly rare. Most of the time you should be able to explain everything. The wording of your diagnosis should reflect your treatment priority, but may contain information on the patterns that are not a treatment priority. So again, if we have exterior pathogen invasion, wind cold or wind heat attacking the surface of the body, usually I will write that first. I'll say wind cold attacking with, spleen Qi deficiency, if there's some other secondary deficiency. My treatment priority in that case, which is resolving the exterior pathogen, I'll put first. One ideal, my ideal, and this, for any profession, the ideal is that your diagnosis, right, the way that you write your diagnosis would allow somebody else to write a treatment principle and, in fact, a treatment plan. Most of the time. I mean, sometimes it's a little bit too general, but what I mean by that is if you're very, very clear, we have fairly standardized TCM patterns. And if you're really clear and we have these fairly standard TCM illnesses, if you combine these two, a TCM illness or disease with the pattern, that really gives me enough information to choose a treatment, right? Without seeing the actual signs and symptoms most of the time. So if you do your diagnosis right, then you just tell me the diagnosis and I could prescribe the kind of the standard TCM herbal formula and points for that disease and pattern. So if you think like that, think about that when you're writing your diagnosis. Is this diagnosis enough for another TCM practitioner to understand and treat by? Basically being clear. Okay, so this is a very short, very, very short outline of the thought process. I may kind of, I'll go into this a little bit bigger. Maybe, I want to do this on the board here. Okay, I'm just going to walk you through the normal thought process that I have when I'm using, so pattern differentiation is the biggest category of how do we say, probably the most important in the pattern differentiation differential diagnosis, right? So we have several different types of pattern differentiation. Usually we start with 8 principles, right? So 8 principles, we have 6 pathogens, we have 7 emotions, 5 miscellaneous. These are actually causes of disease, but 6 evils is also a form of diagnosis, pattern differentiation. We have vital substance differentiation. We have Zhang-Fu differentiation, right? So how do we put all these together in our mind is the question. So a patient comes in with a chief complaint. Usually we go right to the 8 principles, right? In my mind, most of the time I'm saying first, is this interior or exterior? So if it's exterior, right? Or interior. If it's an exterior pattern, I immediately look for what pathogen is present. If this is external wind invasion, I think 6 evils, right? So if it's an exterior invasion, cold and flu, I immediately start thinking, okay, is this cold or heat or dampness, right? So from the 6 evils, we have 3 major sub patterns. One is the cold, in which we think 6 stages. We have heat, in which case we think 4 levels. And we have summer heat, which we think 3 joule, which is also a type of heat here. So, most of the time, okay, so most of the time, if it's external, we're thinking about one of these 3. You know, the 6 stages is an entire, if you don't know what the signs and symptoms of the 6 stages are, you can look into that. But really, if it's external, it's really just talking about, move the board in the middle. You may have to move the camera. Is that better? Okay. External is the easiest thing to rule out, right? I mean, if it's not external, it's internal. So this is why we kind of go into this first, right? Is it external? Are there any exterior signs and symptoms here? Is it cold and flu? Do they have headache, chills, body ache, cough, sore throat, right? Sweating, fever, you know? If they have these signs and symptoms, floating pulse, then we're looking at an exterior invasion. And we want to differentiate based on this. If it's not exterior pattern, it's interior. So my next question, according to the 8 principles, if it's interior, is it excess or deficiency, right? 8 principles, interior, exterior, excess, deficiency. If it's excess on the interior of the body, I still can go to 6 evils, right? And then from 6 evils, I can go back to, well, let's see where I want to write this. Well, I'll get there in a second. Hang on. Okay. If it's excess, usually it's a pathogen. If it's not a pathogen, so for example, heat in the liver is one of the, this is, heat is a pathogen. It could also be what? A vital substance. So chi stagnation, blood stagnation, or phlegm, or food stagnation. Right? These are possible excess interior patterns. Okay? Or 5 stagnations. Okay? If it is not excess and it's deficiency, what can be deficient? Vital substance. Sorry, my handwriting is known for being quite fast and small sometimes. Vital substances. I'm also very small board here. So what can the body be deficient in? Either qi, blood, yin, yang, jinya, right? Body fluids. I think this is actually in your notes somewhere. Yeah, vital substances here. Okay, sorry, I'm going to try and make it so that, I don't know if you can see this or not here, but on the handout, I do have deficiency, vital substances. Which vital substance is deficient? Qi, and then after this, then I can go to what organ, right? Zongfu. Zongfu patterns. And this is the bulk of what you study in TCM for diagnosis. We study the Zongfu patterns. But the question is, when I'm analyzing a case and I'm analyzing information, we're not always given a Zongfu pattern clear and simple. We have to be able to pick at the information we're given to form or find the most appropriate Zongfu pattern. So this is kind of a hierarchical way of looking at pattern differentiation and diagnosis. Does this make sense to people? Yeah? So then the last thing, what I was going to do before is basically, even if we have these stagnations, excess patterns will also be found in the Zhang-Fu pattern. So when you look at Zhang-Fu patterns from any TCM textbook, you're going to see, so for example, we have, like, if you look at the liver, you have liver deficiency patterns. The liver can be deficient in what? Blood or yin, mostly, right? So we have liver deficiency of blood and yin, right? But we have excess heat or fire in the liver. We have, damp heat in the liver and gallbladder. We have qi stagnation of the liver, blood stagnation. These are all kind of excess patterns. Make sense? No. Blood stagnation is excess. Qi stagnation is excess. Qi stagnation can cause a spleen qi deficiency, but this is a whole other can of worms. So at any rate, this is just kind of to review, because this is really important for what we're going to do for the rest of today. I'm not going to spend much time teaching this, because this is way more than a couple-hour lecture here to go through the signs and symptoms of all of these patterns. All right? Okay. So the other thing that I have written here, I mean, I didn't put it on the board, but sometimes we can also identify the, let's see here, if I can do this. If the pattern is in the organ, the Zhang-Fu, or sometimes it's in a specific meridian, sometimes we may be able to identify that the pattern is affecting a channel. So people that are doing, treating mostly musculoskeletal disorders, actually 99% of the time you're only using this. You're not treating organ disorders. You're just treating muscle, skeletal channel. Our meridian system encompasses the what we call the musculoskeletal, tendomuscular meridian. So if you're just treating based on muscle tension, that's what you're doing. How would you diagnose that? Qi stagnation in XYZ meridian, blood stagnation in XYZ meridian, right? We may use this a lot in clinic, but it's a very small component of most case studies. And then the last, sometimes we'll say, for example, the fungal tinea case that I put on last week, we said part of the diagnosis was indicating that this was wind damp in the skin. So we do, according to the Huangdi Nijing, we do have the different levels. So that, skin, disease located in the skin versus in the muscle versus in the blood vessel or bone, if we have certain arthritic conditions, tendons, etc. Okay. Last thing, once you go through this process with a case, make sure, one of the most common errors is exactly your question. When you asked what causes prostatitis, it's very common for us to have some information about that and say, well, prostatitis is commonly caused by this. And the most common error in diagnosis in TCM is to make that assumption off the bat without analyzing the signs and symptoms. So, go back and ask yourself, and when you're writing the exam, don't question yourself, just do it, and do it comes naturally. But at the end, check, is there more than one possibility of the cause of the prostatitis in this, based on these signs and symptoms? Is this the only option based on what I see, or is there something else here? Okay? Specific question, go ahead. I'm going to say no. The question is, do all symptoms that are unilateral in the body indicate a gallbladder pattern? And I'm going to say no, because I'm thinking of just, stroke patterns. Or so, like, there are lots of situations. So yeah, I mean, some very often. So for example, the unilateral tongue coating, it indicates, this is part of a gallbladder symptom. But I would not say that every time symptoms are unilateral, it is always a gallbladder problem. Especially because, like wind stroke, paralysis conditions are usually unilateral, and they're usually not gallbladder patterns. Yeah. Okay. So treatment principle, I'm almost done here. I think that's, I have like an extra page on the bottom there. This is just last little bit here. Treatment principle. In most situations, the treatment principle will reflect the diagnosis exactly. Consider the 8 methods. So are you familiar with what the 8 methods of treatment are in TCM? If you're not, you should be. Release exterior, vomiting, warming the interior, clearing heat from the interior, purging downward, draining dampness, harmonizing, reducing, which really means to, reduce or break up blood stagnation or chi stagnation, or to tonify. Each of these, most of these, can be categorized into subcategories. So for example, release exterior, is it release exterior heat or release exterior cold? Tonify, do we tonify chi? Do we tonify blood? Do we tonify yin or yang? So should be familiar with this. Questions you could ask yourself: are you addressing the chief complaint in the treatment principle? Are you addressing the primary pattern in the treatment principle? And do you need to address a secondary pattern now? Some caps there, interesting capitalizations. I did, interesting. The treatment plan. When you're creating a treatment plan, we said last week, I said last week, don't overdo the points. So I have here, I said 4 to 12. 4 is probably too small for most cases, but some situations it may be appropriate. Remember, 4 points is, if you're doing bilateral needling, it's 8 needles. If you're doing 12, you're up to 24 needles sometimes, unless it's a do my point. They require 3 acupuncture points, right? So, right, 3 related to the chief complaint. So, I've never seen that information anywhere. I've never seen that written down, but okay. So what the student just said was that they require 3 points. So I'm assuming that means that you could use more than that. Minimum, 3 minimum. So there are treatment methods. There is, for example, the 4-needle technique, which, it's probably not commonly used. But at any rate, however many points you decide to use, part of the reason for doing less is that you have to explain less. You don't have to, you just have to know what you're putting down. So in your point selection, you want to question, you want a point that is specifically addressing the chief complaint. So if I go back to that example of kidney yang deficiency with frequent urination, and using REN3 is specifically addressing the frequent urination, right? Or let's say it was tinnitus. You saw this in all of the, last week or all the other conditions. When we talk about a disease and you look at the point selection, you see primary point selection includes, so if it's tinnitus, we use some points around the ear, right? And then we add some points for whatever pattern is the root cause of that tinnitus. And you want to make sure that you're covering both, basically. That's it. Do we usually and always use distal points or not necessarily? Most of the time you want functional points. So in terms of point selection, there's 3 major types. I can categorize point functions as being of three types. They're either local, channel, or special function, right? So local points require very little TCM knowledge. If you have a problem of the ears, you put needles in points around the ears. If you have pain in a muscle, you put needles around the muscle. It's really very, very simple. Every point has a local stimulation effect. Channel points work more closely with the nervous system. So, we can use, a point on a channel that is affecting an area can send the signal up and down the meridian, basically. And we could kind of conceptualize that as an effect on the nervous system. And then the special function is actually where the majority of TCM information lies. So this is when we're talking about, well, the yin spring point of any meridian clears heat from that organ. So, from my perspective, I'm going to say, and those are mostly distal points with the exception of the back shu points and front mu points, which we could say are local to the organ. So if you're only using local points, you're probably not understanding TCM at all, okay? Because most of the TCM information is contained in the distal points. Clear? Are the local points like asha shui, which means like painful points or sensitive points? Sometimes, but not always. I mean, what I mean is that like all the points around the eye can be used to treat the vision problem, right? So, or all the points around the ear. This isn't exactly asha shui, right? This is just like if you look in Deadman and you look at large intestine 11. One of the functions of the point is going to be to treat elbow pain. You know what I mean? That's part of the local function. Every point around the knee will treat knee pain. Every point on the head could treat pain in that area. I mean, it is a local function. But if you just put needles in the area, it doesn't always have a good effect in treatment. And the reason is because we need to think about the cause of the disease, and also because if we know this also from massage. If somebody has an injury and you just work on that area, it sometimes makes it worse. You have to have some kind of understanding of what's going on and why is that going on, and best way to treat it. Okay. Any questions on point selection? Yes. Yeah, last week in the case study, so from my perspective, you should be able to, plan on being able to explain, but the case example that they have online still does not explain why they're using the points. Right? They just list their points. They explain the diagnosis, but they don't explain the points. So from my perspective, you should be able to. I don't know what to say. I mean, my assumption is that you should plan on being able to explain the points, but if they don't indicate it, like, it doesn't hurt. It doesn't hurt to say, write down like I'm, this point to do this, or because of this, and this point to do that. Although the current case online does not do that. My assumption is there's no reason they would penalize you for adding additional information. Yeah. Right. Yeah. Right. Right. At any rate, I mean, I think that the question is whether or not you need to explain the points that you're using, and even though the case example does not have you do that, I would say that it's a good idea, given the time, to be able to do that, to be able to say the main functions. I can't say much else in that besides, unless they give you other directions. Yeah. Okay. So for again, I'll pull up the frequency and course of treatment that I have today, and kind of present that to you guys as like a little template to kind of keep with you. No, you don't have a copy of it because it was just from a book. I can actually at lunch we have it in the library, so I can took photos of just two little charts, so I can either write it down or yeah. For herbs, I don't know how many. Maybe can you check, or Alex can check how many online students? Anybody in here doing TCMP? You're doing TCMP? Yeah, herbs. Okay, so. Check how many people online are doing herbs. Basic formulas for the pattern and illness, modifications if necessary. Keep it simple with your formulas. Know the formulas that they want us to know. They give us a fairly small list of formulas, so make sure you know those. And then lifestyle if necessary, okay? Any questions on this little intro? Was this informative? Was this maybe a little bit helpful? Give you a little insights? Acupuncture contraindications, that's right. You should have acupuncture contraindications if necessary. Yeah, that's right. So, yeah. The other thing that I'm going to mention, which I don't really talk about here, is that make sure that you have reviewed and are familiar with jurisprudence and safety handbooks, all right? How many of you, I know we've all taken that test. If you're a grandparent, you've already taken the exam. But plan on there being questions that specifically ask you about these issues. Sorry? Absolutely. Well, I mean, they could use anything, but you are expected to know and be able to apply this information. So, what's that? For example, not crossing electrical stim on the on somebody with or not using e-stim on somebody with a pacemaker, or herbal dosage modification for a child, or pregnancy contraindications, right? I mean, I don't even know where to start. You're expected to know all of this, and more importantly, in the context of a case study, you're expected to be able to apply that. If they give you a scenario that deals with an ethical question, they can give that to you in a case and plan on. I mean, we know that they incorporate those kinds of questions. It may only be one, but make sure that you're familiar with that. Commonly, it's happening. From feedback from I've heard from other people is that they forgot to review it because we took that exam however long ago, 3 years ago or 4 years ago, whenever they did it, and so they just didn't even think about it. And then they get to the exam and it's, specific questions on it. So that would be the last thing that I would suggest, that you review safety and jurisprudence a little bit. Make sure that you're familiar with the major concepts there. Okay, good. I just wanted to know whether or not, how much herbs, because last week we only had one student online that was doing herbs. So, as far as that, so they provide you with loose paper. Okay. So for everybody that's online, sorry, it's like a conversation. For everybody that's online that can't hear the conversation in the classroom, basically the question is, can you bring in notes? You cannot bring in any electronic devices. You can bring in any printed paper notes. That's even with handwriting in the book, it is okay. And they give you pencils, and there will be blank paper at each station. How about just written notes that aren't printed? You can't write your own notes that aren't printed? As long as it's not handwritten? Huh. That seems strange to me. I would read the. I'd have to go back online and read what they have written about it specifically. But sorry, they have to have they do have that information. Yeah. No. No. Okay. All right. Anyways, let's. Okay, somebody has an email printed from the college.
The question was, are you allowed to bring in textbooks with your handwriting in them? They said, yes.
Okay.
Highlighted or underlined or written notes, and the answer was absolutely.
Yes. Okay. So if you have a textbook with highlighted, underlined, or written notes in it, you can bring that in. Somebody has an email response saying that. I can't say that. I don't work for them. They change things too. So, I can't answer that question. Yeah, the electronic devices you can't bring in. Okay. Any other questions on this? Done? Okay. So, do we want to take a short break before we actually get into the case studies? All right, let's take 5. Hello. Okay, so we're gonna try something interesting here. So this little set of case studies I've pulled from a textbook, Ma Chiocha's Practice of Chinese Medicine. There's a number of reasons I like these. I mean, if you could get this textbook if you want, but just because Ma Chiocha's cases are fairly standardized information, meaning that they're commonly used. But what we're going to do, we have other cases that are prepared that we're going to do, but I'm using these just to kind of teach and walk through a little bit and see where everybody's at and get us warmed up with cases. And make sure, the emphasis is a little bit on pattern differentiation because that's where most of you are weakest. So we're going to spend more time looking at that, okay? So, actually, if you had the textbook, the case history numbers, you'd be able to find them in the textbook, but I left them on there for that reason. Okay, so we also have the disease or the illness is actually already listed for us, meaning that we see chest pain here. So when I see the information, what happens? Okay, chest pain. I see chest pain. What does that tell me? It tells me a little bit about the disease. It also tells me that I should have a red flag being concerned about possible need for referral, right? If we have a chest pain case. Angina, myocardial infarction, I should already be thinking, is this a situation where I need to refer? Have they already seen their family doctor? Is it already managed or not? If it's not, they probably need to see their family doctor. If it's acute and severe, they may need to go to the ER, right? I don't know. I haven't gotten any further than that, but I know that in my mind right now, that's what I'm thinking. Next thing I see is age 74. All right, a 74-year-old man is a specific demographic. This tells me information that matches or, in accordance with TCM theory, right? A 74-year-old man may be deficient. He may have other conditions. In general, that's what I think in my mind. But I don't make that assumption. Like, I can't say anything more than I know that is a possibility. He had been suffering from what had been diagnosed as angina pectoris. So here's your, I'm expected to know what angina pectoris is. If I don't know what angina pectoris is, and if I don't know the difference between angina pectoris and a myocardial infarction, I'm expected to, right? For 1 year, okay? The attacks were elicited by exercise. Well, this is actually the definition, or one of the definitions of angina pectoris. Worse with, cardiovascular exercise, going upstairs, whatever it is. So from a TCM perspective, I also know, let me go back to angina pectoris, I also know that this is essentially chest pain, right? And so from a TCM perspective, I know that pain equals stagnation. I know for sure there's stagnation, right? Stagnation. If it is worse with exercise, okay, worse with exercise here, elicited by exercise, that is actually part of angina. But if I was looking at just a TCM paradigm, I might say, oh, well, there could be a deficiency problem here. But I'm not sure, because this is really the manifestation. It is also worse with cold. Now, according to TCM theory, pain that is worse with cold would indicate what? Not exterior, would indicate cold. Exterior is cold and flu. This is definitely not, so immediately, just based on the first sentence here, I know this is not an exterior pattern. Nope. Well, there's no signs of cold or flu. There's no pathogenic presence here. Just because it is worse with cold, it means it's cold. Doesn't mean it's exterior, right? So worse with cold makes me think that it's possibly a cold problem. However, we also know that cold causes constriction, and angina is commonly worse with cold. So again, I have that in my mind. It's also worse with eating. Now that means it's excess in nature. Okay? You guys see that? So in my mind, that's what I'm thinking. If I have pain in the chest that is aggravated with eating and adding food, basically adding something to it, it means that it's excessive in nature. So that's a general, this is all 8 principles diagnosis. If I take just that first sentence, I have no information of exterior pathogen, no chills, fever, body aches, headaches, sweating, right? We haven't got to the pulse. But because of that, I'm assuming this is internal. There are situations where we may have chest pain due to exterior pathogen, but, normally it wouldn't say he's had a 74-year-old man who's had angina for the past year. It would be more likely to be somebody who's had a cold and flu that has, gone into the chest and caused tightness of the chest and something like this. So see the difference between the exterior invasion and an interior pattern here. Okay, what else do we have? The pain in the chest was quite severe. So quite severe could indicate, it's possible that indicates blood stagnation. What is blood stagnation, right? In TCM, the textbook signs and symptoms that I look for are fixed stabbing pain. Now, I know that angina is generally, fixed means in the same place. It doesn't move around to different places. Like one day it's here, the next day it's here, the next day it's here. Most of the time angina is in the same place. But because they're saying that it's severe pain, the pain is quite severe, to me it could be blood stagnation, not 100%, but I think that in my mind. He also complained of a feeling of heaviness of the legs. Heaviness often indicates what? Damp, right? Heaviness of the legs may indicate a kidney issue, right? Because kidney governs circulation in the legs. He looked generally quite strong. What does that help me say? Not deficient, that it's probably an excess condition rather than a deficiency. So that goes, so now we're getting into, demographics are really general assumptions. We say, oh, if he's a 75-year-old man, he might be deficient, right? I said that is my assumption that I make. But when I get to the actual signs and symptoms, he doesn't show deficiency. He's showing obvious signs and symptoms of being strong. That would that would weigh higher, right? We can't make any assumption based on demographic here. And had no other symptoms. So again, that kind of shows me that if he's generally strong, most of what I see, all the signs and symptoms are really more excessive, right? I see cold, I see excess, I see stagnation, I see blood stagnation, possible dampness, possibility of a kidney weakness, but not necessarily. It's just a possibility. Otherwise, he's strong with no other symptoms. So is this a exterior or an excess or deficiency case? Excess, of course. What is in excess? If I go back to my little chart here, my little flow chart, okay, we said it's interior, okay. Now I said, is it excess or deficiency? So, oh, it's excess. So your question is, what is in excess in this case? All right, let's keep going. His voice and spirit were strong. This also indicates excess. You know, he's like, you can tell that whoever did the case is like really a 74-year-old male who has no, we're confirming he has no deficiency. Even though that's the norm for that age to be a little bit deficient, we're kind of confirming or affirming that he really doesn't have deficiency. He's really quite strong, right? His tongue was reddish purple. What does that indicate? Stagnation of blood stagnation, doesn't it? Purple, blood stagnation. What about the red? Heat, blood stagnation and heat, right? So, okay, what does a yellow coating indicate? Also heat. And what does a wiry and full pulse indicate here? Wiry could be liver. GB, yeah. What else? Hang on, stay on wiry, because you haven't explained. You said one thing it could be, which is a liver condition. Does he have other signs of liver condition? It can be deficiency of what? No. So my question is, I'm trying to make sure that you're clear, because that's the error that people can make. Wiry pulse, always. Now, in all fairness, it does often indicate a liver condition, but it is commonly present in other conditions, specifically blood stagnation and pain. Okay? So in this case, we have to consider that, right? Full means, again, excess. Wiry really could be liver, gallbladder, or blood stagnation. So this is, the reason this is important is I'm trying to show how each sign and symptom usually could indicate more than one thing by itself. And then what we do is we go through the entire case and we try and find, well, what's the most common thread, or the explanation of a pattern that can explain all of them, right? What is the common thread here? So in this situation, what is the best diagnosis? Where? Heart, blood stagnation. I mean, this is, so heart blood stagnation is really the primary pattern, right? We have signs and symptoms. We don't have to say excess here, because blood stagnation by itself is already excess if we don't say anything else, right? You don't have to say that. Because there's no deficient blood you would have to say blood deficiency and blood stagnation if you wanted to indicate if you just say heart blood stagnation, the pattern itself is an excess blood stagnation. Signs and symptoms, the treatment principle is to move blood, to break the stagnation. This is reducing technique, right? It is treated as an excess. Okay? So now, my question to you is there heat? There is heat. Do you need to treat? Is there damp heat? Yeah, so what now you identified the main pattern, the primary pattern. This is both what's causing his chief complaint, and it is what it is our treatment priority, right? So that's good. If you got heart blood stagnation, you're more than halfway there here, right? The question is there something else that we need to consider? So is there dampness or is there heat? So we said the tongue is reddish purple and it has a yellow coating. Are there other heat signs and symptoms? The question is the relationship between the diagnosis and the treatment plan. The question of whether there's heat in the diagnosis really should correspond with whether or not you want to clear heat from this patient. So do we need to clear heat from this patient? No, we don't. Because when we remove the stagnation, the heat will likely be resolved. More importantly, there is no other signs of heat. So if there was constipation, yellow urination, a feeling of heat, then I would say yes, right? Because there are signs and symptoms of interior heat. But without any other signs and symptoms, we don't, okay? The other common, the other common mistake in this case would be, is there cold? We have pain that is worse with cold, right? Is there cold present in this case? Well, there's a few ways of looking at that. One, look at the tongue. The tongue shows there's obviously no cold. I already explained that the cold causes stagnation. So the question of whether or not, just because it's worse with cold, doesn't 100% mean that we treat it as cold. Do we want to use warm, acrid herbs or add heat to this patient to treat? No. It's just because it's blood stagnation. The cold makes it worse. Cold causes this tightness and constriction. Make sense? So by resolving the blood stagnation, we actually resolve the other signs and symptoms. The last question is around dampness. Is there dampness present? Now, I'm going to argue no. Okay? I'm going to say that there are no other signs of dampness. Why does he have heaviness in the legs? Again, this is the effect of the angina, the malfunctioning of the heart. The heart doesn't circulate as well to the lower limbs. So because of the tongue, because the tongue doesn't show anything, because the pulse doesn't show any dampness, because there are no other signs of dampness, I'm going to explain the heaviness of the legs and lower limbs by the heart fire not penetrating down. I should write that out in my diagnosis. So, if I was explaining in my diagnosis, I would say, okay, when we actually get to doing the case studies that we prepared, you're going to have to write out, okay, the diagnosis is heart blood stagnation because of symptom 1, 2, 3, 4, 5, and 6, right? Symptoms 7 is caused by this, 8 caused by this, and 9 caused by this, right? Which are all an effect of pattern 1 in this case. Does that make sense? So for example, blood stagnation because he has severe pain in the chest that is worse with cold and eating. This is angina. A purple tongue, wiry pulse, right? That's essentially what we're saying. Those are the main signs and symptoms, okay? And then I might write the heaviness in the legs is due to this. Now, I try and look at this case objectively based on the information that's presented. Maciocia or whoever else may have different perspectives, but I'm a big advocate for objectively looking and not making assumptions. Look at the information that's presented, understand it, comprehend it, and make the direct connection between the treatment plan. Do you treat that part of the pattern or not? Okay, so just for mental exercise, what are the main points that we would use for this type of a case? Don't look that up. I'm kidding. You can look it up if you want. What are the main points that we would use for heart blood stagnation? Heart 7, probably not. Why not? We could. I would use pericardium, 6? I would use pericardium 6, maybe 7. but 6 is stronger. Give me 2 other points. Yeah, so bladder 17 or bladder 15 here? Well, bladder 15 is a back shu point. We could use it. Sure, it could be added, but bladder 17 is more important because the diagnosis is blood stagnation. So 17 is more important in my opinion. What is one other very important point? Ren 17, exactly. Influential point for chi, influential point for blood. The Ren 17 is our local point, right? I mean, essentially in this case, Ren 17 becomes the local point. It opens up the chest, is addressing the acute problem. Pericardium 6 becomes the point that opens the channel and is an empirical point for this type of disease and signs and symptoms. UB17 Ge-shu is the influential point for blood, and so is an empirical point for the disease, the pattern of blood stagnation. Does that make sense? These are probably the important. Write it down. Okay, so what did I say? Ren 17, UB 17, and PC6. I mean, there's lots more that you could. Could you use Heart 7 or UB 15? Yes, you could. These, in my opinion, are more important. I may even add, if I wanted to, spleen 6, because spleen 6 moves blood stagnation, and we do have this heaviness of the legs. You know, but at any rate, these are important points. What about formulas? What formula would be empirical for heart blood stagnation? You don't know? So shui fu zhu tang. Whoops, what did I do? Sorry. Oh, you know what? Sorry, I have to plug in my laptop. I'm afraid it's going to shut down on me. That might be what happened there. Shui fu zhu yu tang. Okay? Shui fu zhu yu tang. So far, so good? Everybody doing okay? All right. These cases are really, again, just meant to kind of warm us up and get us familiar with this process of case analysis, and then we're going to go into the sample cases in more detail, and you're going to practice them and do them on your own a little bit. So I'm going to do at least 1 or 2 more with you, and then I'm going to have you guys, give you some time to do some on your own. So case 14.2, epigastric pain, 45. So this is, again, is the illness or disease, epigastric pain. In my mind, once I'm given that, I know what are the main TCM causes, okay? Is epigastric pain internal or external? Well, it's theoretically possible for it to be external. I mean, we could have, if it is external, it would probably be summer heat, damp, attacking the middle jiao. That would be kind of that would be a stomach flu. So is that possible? Yes. Likely, not really, especially once I get to 2 years. That's going to tell me this is almost certainly internal, right? It's possibly deficient because it's chronic. Pain was dull, worse when lying down. So dull indicates what? Dull indicates likely, well, not chronic. Dull and chronic are 2 different things. Dull, is this deficiency? Not necessarily. From my question, is dull is describing the nature of the pain. It's helping me understand what is stagnant. So when I think dull epigastric pain, I don't think blood stagnation. I think phlegm, chi, possibly food stagnation. But, a dull epigastric pain is telling me information about what is stagnant inside the body. Does that make sense? Okay. It's worse when lying down. Well, that again, no, worse when lying down lends more to food. Sorry? worse with lying down, not necessarily. Well, it helps. It lends more to either food stagnation or phlegm stagnation, but likely more food stagnation, possibly phlegm. Meaning, chi stagnation is usually not going to be worse from a change in position like this. This means that there's something like almost like a mass or physical that's like pressing when she lies down. Okay, aggravated by pressing on the area. What does that indicate? Excess. Accompanied by slight nausea. What does that tell us? What's that? Wrong. Does not tell us spleen. It tells us stomach what? Nausea is stomach what? Rebellious stomach chi. Okay, rebellious stomach chi. And nausea and acidity. Again, acidity here tells us there's some stomach rebellion. Okay? When the pain was bad, she also became constipated and her appetite decreased. So constipated often indicates what? Could indicate heat, but does it indicate heat here? No. Okay, let's just, we can say heat or sometimes constipations. Blood deficiency or yin deficiency. But this really, we're not quite sure so far. And her appetite decreased. Okay? Possibly. So, appetite decrease, what do we normally think of? Immediately we think poor appetite, what? Spleen weakness, possibly. Yeah, but here we have pain causing a lack of appetite. So if pain causes the lack of appetite, isn't that, it's almost a normal, we have epigastric pain. Of course, if the pain is severe, read the sentence. When the pain is bad, she also became constipated and loses her appetite. So this is the loss of appetite in this situation. I'm not sure that it's spleen. It may just be related to the stagnation. So we have, for example, in phlegm, damp retention, or food stagnation, these are the main two possibilities in my mind right now, right? These are the main two patterns that are possibilities in my mind. If I come back to my board here, I said immediately, okay, this is not external, this is internal. What did I know right away? Well, I knew it was excess because it's worse with pressure. So then my next question is it heat? Like, what is the nature of dull pain? Dull epigastric pain is most likely caused by what? Well, if it was cold, it would not likely be dull, and it would likely have an onset related to, it would be like a tighter pain, or aggravated or onset related to eating something cold, right? Here we have aggravation with lying down with dull pain, so it's most likely phlegm or food, or, we also have this rebellious stomach chi, right? Nausea, acid reflux, right? Anyways, so what was my question here? Oh, so the constipated, the question is, the decrease in appetite also happens with these two cases. So yeah, decrease in appetite could indicate spleen. That's kind of the textbook 101 that we think about, but in the context of a case study and in the context of TCM patterns, if you look up phlegm retention in the middle jowl, or blood stagnation in the stomach, or food stagnation in the stomach, all of these patterns also have a decrease in appetite. Make sense? So in my mind, I don't see anything to really indicate a specific spleen deficiency yet. Okay, so slight feeling of fullness, well, that just kind of matches everything else that we've had so far. Of course she does. Besides this problem, she had also experienced some slight bleeding between periods with light, fresh blood for 4 months. What does that indicate? So you might be getting liver fire rising up into the stomach, but would that cause slight bleeding between periods with light, fresh blood? Tell me how that would cause that. So liver stagnation would cause bleeding, slight bleeding between periods with light, fresh red. You'd have to show me that, because normally liver stagnation would cause an irregular menstruation, and it would not. There's no TCM pathology where specifically that would cause this normal. So well, let's not worry about that right now. The question is, what does this indicate here? So if we have bleeding between periods in TCM, we should know what are the causes of bleeding. One cause is what? What do we say? Spleen not holding blood, the spleen deficiency not holding blood. What is the other cause? And this is what I was waiting for you to say when you said liver fire. But you said it, but you didn't understand. So that means tells me that you didn't understand the possibility. Heat can cause bleeding, right? Heat can cause abnormal menstrual bleeding. So it is possible that liver heat would cause abnormal menstrual bleeding. But does that match everything else we have so far? Not really. I mean, we don't have any other signs of heat so far. Possibly we do have constipation. So, we could have looked at it that way. But let's just keep it real simple for now, because the slight bleeding between periods with light, fresh red blood, the way that that's described, is really a spleen not holding blood pattern. Okay, her pulse was slippery. What does that indicate? Damp or phlegm or damp or phlegm, or because a slippery pulse can indicate quite a few things. Keep going. You should know these. It could be damp or phlegm or spleen deficiency, possibly. Or what? Food stagnation. Or what? Pregnancy. Right? I mean, these are all possibilities. I'm trying to get you out of that space of making an assumption. All right? So these are all possibilities with the slippery. Slippery on the whole and weak on the right side. So what does that indicate? On the right side. The stomach and spleen is the right guan, or second position of the right side. They're saying weak on the right side. So, yeah. I mean, really all we can say is it indicates the lung, spleen, stomach, and kidney yang. I mean, all of those pulses are on the right side. So, normally we say that the right side corresponds with the yang energy of the body. Weak on the right side. So that's, lung, spleen, kidney, etc., etc. Her tongue was pale. What does that indicate? Deficiency of blood, qi, something like that. But with a bluish purple tinge. What does that indicate? Well, purple certainly is stagnation. And specifically maybe a cold. I mean, the bluish would indicate some kind of cold there. Teeth marks. Teeth marks show what? Real specific there. And a sticky white coating. Sticky? Sticky normally, sticky would normally indicate what? A sticky white coating. Phlegm, right? What else? Dampness, possibly. I would rather, because we have greasy and we have sticky. Usually sticky, sticky would usually indicates more of a phlegm or food stagnation. Okay, so now we have all the information. So, who wants to take a stab at taking? We did the breakdown. So what's your diagnosis? Based on what we've done, I want you to write down. Okay, so sorry. Let me do this one a little bit with you again. So we already said this is internal. We already said this is excess. The question, right? So let's go back now. Actually, we said this was excess before, but we have a lot of signs and symptoms of what? Deficiency of what? Of spleen. So this is real common, right? Well, this is a combined excess and deficiency. So we have clear signs of spleen deficiency and clear signs of excess something. So your job in terms of diagnosis is to say what is in excess here, and then which part of the pattern is the primary and which is the secondary. So, meaning, is it more important to tonify this person, or is it more important to resolve the excess? Or some combination, right? So first of all, what is stagnant here? Blood? Why would we say blood stagnation? Well, there's one reason why we would say blood stagnation. What is it? No, because of the tongue. The tongue is the only thing. The tongue is the only thing that may indicate blood stagnation here, but the rest of the signs and symptoms do not. There's, from a treatment perspective, if you give this patient blood-moving herbs, you're going to make them more nauseous. You cannot give this patient blood-moving herbs. Blood-moving herbs are really hard on the stomach, right? So they have weak spleen and stomach with nausea already, and you give them blood-moving herbs is no good. Okay. So what is stagnant here? What is in excess? No, what is in excess? Phlegm? Okay. So, sorry, because they have to hear whatever we're talking about. So keep your comments a little bit concise. So the question is this? What do we have? What did I write down? Okay, spleen deficiency, food or phlegm. I'm talking about what is the stagnation here? Food or phlegm, rebellious stomach chi is something that we should consider. Damp or phlegm, or pregnancy, not pregnancy here. We're not worried about it. Phlegm, food, or damp. So really, these are our three options: phlegm, food, or damp stagnation. Okay? It could be any three of these based on what we've written. So what is the best answer? What is stagnant? Well, you have to know the difference between these three. Is there phlegm here? Is this a little bit too advanced for Saturday morning? I'm not ignoring teeth marks. You're now listening to my question. I already said we have spleen chi deficiency. There's no question about that. The question is what is in excess, because spleen chi deficiency does not cause epigastric pain that is worse with pressure. So the fact that we have epigastric pain that's worse with pressure shows me that there's something accumulated in the body. Is this dampness? No, dampness is not the correct answer. Stagnation, yes. The question is, what is stagnant? Is it food, phlegm, or dampness, and why? Phlegm and why? But I already said slippery could be food or phlegm. That also could be food or phlegm. So why food and not phlegm? There's not enough dampness showing up in other places. Well, okay. So there's the reasons that food stagnation is a better answer here. I'm just going to keep moving on because no, that's not the reason, because that could be food or phlegm again. The main reasons are with the nausea and acidity. Acid reflux and regurgitation is more common with food stagnation than it is with phlegm stagnation, and the constipation, because when we have food stagnation, it tends to block the digestive system. So when food stagnation is more severe, we can actually get constipation. We don't normally get that with phlegm stagnation. And the last, so this is a better answer in this situation. So The treatment principle in this situation, do we want to resolve phlegm? We may, like the other issue is that she has no substantial phlegm. So it doesn't say anything about her having phlegm. So while phlegm, a lot of these signs and symptoms could indicate phlegm, because there is no actual phlegm, it reduces that possibility here. Okay? So in this situation, I'm still going to tonify spleen, and I'm going to resolve food stagnation. Right? I guess the next question with this case, if I go back to my little intro there, would be, is there a clear indication of which one came first, the chicken or the egg, right? The spleen deficiency or the poor functioning of the digestive system? We don't have a pathogenesis. We just know that she's had epigastric pain for 2 years. So there is, it's obvious that it's a little bit chronic, and there's no one then the other that's indicated. There's no pathogenesis. It doesn't say had this and then had this. It just says, has had this for 2 years. Well, a spleen deficiency could cause poor digestive function, which could lead to food stagnation. Or poor eating habits could cause stagnation, which then lead to the weak functioning of the spleen. I mean, we just don't have a clear. How does it change your treatment plan? That's the question. Whenever you're confused about a case, go to your treatment plan. Say, how do I treat this? What is the best way for me to treat this case? So in this situation, let's go to points. All right. So what? Sorry? Stomach 25? Okay, maybe. Probably I may include that, but what's the most important point? No. 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 Most important point. No. It's not the source point. Spleen 4 is not the Yuan source point of the spleen. Spleen 3 is. Ren 4 does not tonify the spleen. It does not resolve food stagnation. Why would you use that? UB20. Okay, so yes, we could use that. Ren 12 is the answer I was looking for. Ren 12 is the first point you should think of for epigastric pain due to stagnation. It is a master point of the Fu organs, so the yang organs. Basically, we have digestive obstruction in the stomach. We have poor movement through the bowels, constipation. Ren 12 is the first point you should think of. It is also the front mu point of the stomach. We're essentially diagnosing this as an excess condition of the stomach. So you should first think of this point. What are the other points we should think of? Well, in this situation, and I should also mention that Ren 12, again, has that local function. You're essentially addressing the chief complaint of epigastric pain, right? So, yeah, Ren 12 is the first thing. Stomach 36. Why is stomach 36 useful here? Right? It is the command point for the abdomen. It also serves a function to tonify. Could we use some other points? Probably, right? What else would we use? What are other important points? UB 20 and 21. I'm going to put both down because we do have a little bit more of a complex case here because we have deficiency and excess, and we need to address both. All right? So UB 20 and 21, sure. What else? Spleen 3. Okay, spleen 3 we could use, yes. This will tonify the function of the spleen. Spleen 6 could use maybe. Okay, these are possibilities. Spleen 6, spleen 3. Okay. Yeah, so you said stomach 25 also. I'd say that that's probably good because they have constipation. It does nourish the digestive system. But actually the other big point for me is, no, not LI4, is PC6. Anybody know why I would choose that here? because of the nausea, acid reflux, and rebellious qi, and pain in the interior, right? Because there's pain here with nausea. You know, this is essentially, it's a form of rebellious qi and obstruction. So, you know, we could choose that as well. Okay. You know, what is the empirical formula for food stagnation? Okay, Liang Fuan. Okay, we could, or Bao Hewan, right? You know, we could use that or modify that. Sure. You know, again, it's a question of like, assume that you did have to explain why. You know, how many? I would probably not list more than 8. Ren 12 is probably doing a lot, but yeah, you could use a lot of these points. Actually, all of the points in this area do resolve food stagnation. No, she said you had to have 3 points that address the condition, the disease, or the chief complaint, right? Okay, how are we doing so far? So, how do you guys feel with this? Is this terrible? Okay. Next case, epigastric pain. So I'm going to do this with you without writing on the board this time. So basically I'm going to talk out loud as if I was doing the case. I'm not going to write it on the board, so I'll go slow, but I want you more to just think about it. Read it with me, okay? Case history 14.6. Epigastric pain, female, age 47. A 47-year-old woman had been suffering from epigastric pain for a few months. The pain was dull and improved with pressure and application of a hot water bottle. That, to me, indicates that this is a deficiency and possibly a cold. So because it's deficiency and cold, it means that it may be a yang deficiency or qi deficiency. Okay? It's epigastric pain. It could be either at this point, possibly more of a yang deficiency because it's better with heat, but her appetite was poor and she felt easily tired. Poor appetite also matches, well, in this case again, deficiency of spleen, really, is what I'm thinking. If I compare that to the last wording, it said, you know, in the last case, it said when the pain was bad, she had a decrease in appetite. Do you see the difference there? The subtle difference in wording? One is saying her appetite was poor and she's tired. The other one's saying when pain is bad, the appetite goes down. So, you know, this is, again, is like, you know, even though we said that there's still some signs of spleen deficiency in the last case. Okay. And she felt easily tired. That, to me, confirms deficiency. I don't know of what, but she easily felt cold. That is a second sign and symptom of a cold. So if in my mind I'm questioning, is this deficiency? It's deficiency of what? Qi, blood, yin, yang. What is it a deficiency of based on the information we have? To me, this is confirming this is yang deficiency and not qi deficiency. Why? Because there is cold. It's A, better with warmth. B, it is B, she feels cold, right? She easily felt cold. Her tongue is very pale. To me, confirms. Now I'm in this state, if we think of like subjective, objective, now I'm going to this objective. The tongue confirms my suspicion of deficiency. Slightly swollen. Okay, now in my mind I'm thinking, is there phlegm or dampness? Okay, that's something that comes to my mind. With transversal cracks on one side, transverse cracks on one side. Okay, not entirely, you know, this, I'm pretty sure that transverse cracks in Machiocha indicate the spleen deficiency. Her pulse was weak and deep. Okay, now what does that indicate to me? Weak indicates deficiency, but deep confirms no. Lack of yang deficiency. Cold would be what? A tight pulse. Deep confirms that the cold is deficient cold caused by a yang shu, yang deficiency. Ming bai bu ming bai. Ming bai, good. It means understand or not. Okay. So what I would like you to do now that I've told you the answer is write down your diagnosis. Write it down on your paper. At home, write down your diagnosis. Message it in to the, message in your diagnosis. Okay? Go ahead, write it down. Did you write it down? Because I'm going to ask you. I'm going to ask you what you wrote down. Because I want to see how you word a diagnosis. It's not better with cold. It's better with warmth and and she feels cold. So when we talk about, this is my very simple 8 principles pattern differentiation model. We'll look at signs and symptoms in relation to yang deficiency and yin deficiency, qi deficiency, and blood deficiency. So in the case of the spleen, we have many signs and symptoms that could be similar. So for example, epigastric pain, low energy, bloating, these all, they could be present in either yang or qi deficiency. What is the difference between these two? Yang deficiency means we have cold signs and symptoms. Qi deficiency pretty much all the signs and symptoms of qi deficiency could be present in yang deficiency, right? I mean, yang governs qi. Qi pertains to yang. Likewise, when we have blood deficiency, we don't so qi deficiency, no cold symptoms, right? Blood deficiency and yin deficiency are the same thing. If we had, liver blood deficiency, there is no heat signs. Means the tongue is not red, we don't have hot flashes, we don't have night sweats, we don't have any heat signs. Yin deficiency, there is heat signs and symptoms. Okay, so this is, why I said that in this case, those 2 signs and symptoms, help us differentiate that this is, in fact, yang deficiency. Clear? Good. The last thing which I didn't say was actually the swollen tongue is more common with the yang deficiency because yang governs water circulation, water metabolism. So qi deficiency would more likely, it's not, this is not 100%, but like 80% of the time, the spleen qi deficiency would show teeth marks and then, digestive malfunction, where yang deficiency actually doesn't circulate water. Yang doesn't circulate water. Heat symptoms. No heat symptoms. Heat symptoms, no heat symptoms. So again, yang deficiency, cold, does have cold signs and symptoms. Qi deficiency does not have cold signs and symptoms. Blood deficiency does not have heat symptoms. And yin deficiency does have heat symptoms. This is a very general thing. I realize some of you have not, had a lot of TCM pattern differentiation. Okay, any questions? So what did you write down for your diagnosis? Epigastric pain caused by spleen yang deficiency. Okay, does anybody have something different? Everybody wrote that down. Good. Okay. If nobody has anything different, then we're all at a good place. So what I said again in the intro, if I take this, for one, you have the illness. 2, you have the pattern, right? That's good. You're including both rather than just the pattern or just the illness. 3, if I take this information, I can actually create a treatment. So, my treatment plan based on this is to do what? What's your treatment plan? Okay, so this is a problem. We don't want to give energy. That's not a treatment plan. What's the treatment plan based on this diagnosis? Tonify yang of spleen. Include everything. Because if you just say tonify yang, I don't know what you're tonifying yang of. So again, if you think that when you write your treatment plan or your diagnosis, that it has to be enough for me to treat, I have to know to choose yang tonifying points on the spleen, not on the kidney. Does that make sense? Not just what is deficient, but where is the deficiency. So yeah, treatment plan would be tonify, spleen, yang, and anything else? Do we specifically need to do anything else for the epigastric pain? Yeah, I don't even know if we need to, honestly. I mean, there's not. It's not severe. From my perspective as a TCM professional, I don't think I really need to. I may, however, I probably don't need to here either. Because I'm tonifying yang, I don't even need to indicate that I'm warming up, but I could add that. More likely than stop pain, I would add warm, warm the middle jowl or something like that. So, and the reason I'm adding this into the treatment plan is, again, if I think that I want you as an acupuncturist to take what I wrote down and treat the patient, it's just, of course, we wouldn't do this normally, but I want you to think like that in a standardized way. I want you to use heat therapy, moxibustion, heat lamp, whatever other kind of heat therapy to warm them up. So, this is also a TCM treatment principle. If I'm thinking herbs, I'm thinking Li Zhongwan, this Li Zhongwan to warm the center, right? This, in simple terms, ginger. What are in this situation, what are the lifestyle recommendations that we would want to include? Don't eat any cold food, don't eat raw food, eat more cooked food, eat more warming spices, ginger, cardamom, etc., etc. That's probably important in this case because of the diagnosis, right? Any questions? What's your treatment? What's your treatment here? Moxa. This is super important because it's a yang deficiency. We want to add heat. So again, even if you don't use moxa in your normal clinic practice, a lot of people don't because of the smoke. Maybe you use a heat lamp or you use a heating pad, in certain situations to warm up and add heat to, think about that. So moxa to what points? Okay. Ren 12. Oh, what happened? Something happened. Okay, that's fine. It's fine. I just went to sleep. Just scared me for a second. So yeah, Moxon Ren 12. Actually, we can use some of the same points. Stomach 36, command point of the abdomen, addressing the chief complaint. These 2 points. Now I'm doing moxa because it's cold. The last one we could do moxa, but we didn't need to because we're actually trying to reduce the food stagnation in the last case, right? Here we don't want to reduce any stagnation. I probably don't need to work as much with the stomach. Here I would want to focus more on the spleen. I probably do choose spleen 3 or something. And UB 20. I don't know. That would be a kind of a good kind of key 4 points in this situation. Again, some of them are similar, some maybe a little bit different, but the key point here is that we want to warm it up because it's yang deficiency. Sure. Or I would apply acupuncture and moxibustion to these points. Sure, you could say with reinforcing method. Yeah, tonifying. Ren 6 would be a really good one, yeah. Ren 6, yeah. Ren 6 for Qi deficiency. Ren 4, you know, Guanyuan is more for like kidney deficiency and source, say source, like Yuan Qi deficiency. You could use Ren 10. It has a stronger spleen tonifying effect. So Ren 10 and Ren 6 are commonly used. You know, because they say epigastric pain is why you know, Ren 12 is just kind of an empirical point. There's some, you know, discomfort there. So that's kind of like epigastric, where Ren 10 is a little bit lower. Ren 6 is lower. Ren 6 is for Qi deficiency. But when we add heat, when we do with moxa, you know, the moxa will warm up. But again, the reason I'm choosing Ren 12 first is because when you say epigastric, it's in the area of Ren 12. Ren 6 is way down here. So while yes, it does do well to warm up the body, warm up the qi, you know, of the whole body, and if we apply moxa, the yang. But really, I think these are still most important. Okay. Again, in terms of formulas, you could think Fuzi Li Zhongwan here, right? Yeah, or Fuzi, huh? Liang Fuan. Yeah, you could use that. But yeah, so with herbology and acupuncture, it's not that there's only one correct answer. You know, whoever, so basically they hire people like me. I'm not hired, but they hire professionals, people that are members of the college, to mark these exams, right? So basically somebody's going to be going through and saying, is this appropriate for these signs and symptoms? Are they, you know, are these points appropriate for this treatment? Do they understand the cause and the nature of the disease, you know, or not? So if you, again, if you're not using like let's say you were going to use some kind of non-TCM, and most of you are not, but like something different, then maybe explain why. But otherwise, my question as a TCM practitioner does this formula tonify spleen, warm up and tonify the middle jiao and strengthen the function of the spleen? And as long as the herbs within that formula are appropriate, then it would be acceptable, right? Any questions? Is it break time? 11:30? Thanks. Let's take another 5 or 10 minute break. We'll come back, and then we'll go till lunch. We'll take lunch at 1, right? So we'll take another short break, come back, take lunch. We'll do more cases when we come back, and then take lunch. Hope everybody's staying warm at home. A little cool in here. It's all right. We're doing okay, right? Everybody okay? Good. Yeah, what are we doing? Are we solving the case? Let's go into it. Case history 17.1, abdominal masses. So this time, it's short. I would like for you to read through the case on your own, and and this time I'm going to give you some questions. The point is I don't want you to look this up. I mean, the whole point is like, put your books down. Okay? Use the information that you have already, that, you know, what you've learned, even if it's just from these workshops, you've learned something. Use what you have. What's that?
There's going to be a lot of books open during the
I want you to put
Which
your
is fine.
books down.
Yes.
Very good job.
Yeah. No, put your books down. Read it. That's fine. That's good. It's good, but it is something that could be potentially problematic. So, you know, take your time. It's a real short case, and see what you know. How do I want to? Okay. So my first question, is this an internal or external pattern? Is this excess or deficiency? Short and simple. Is it excess or deficiency? It is excess. Is there any sign of deficiency here? Wait a second. Oh, what happened to my on-screen here? Is there any sign of deficiency? I have to read through the case because I haven't done this yet. There's no sign of deficiency, right? So this is definitely excess. My next question on this case is, what is in excess? Did you just say phlegm is in excess? What sign of phlegm? Say again? Don't say, I'm saying what is in excess, not where, what? Blood. Blood is stagnant. Blood stagnation. So again, if we, if we say this is internal excess, my question in my mind, based on that flow chart that I put up on the beginning, is what is in excess? Is it one of the 6 pathogens? Is there heat or cold or dampness inside the body that is causing an excess? Or is it one of the vital substances that is stagnated, meaning chi or phlegm, or sorry, chi or blood are the 2 vital substances that stagnate? Or is it another substance such as phlegm or food? These are really the possibilities of stagnation. Question.
Blood stagnation, why? Because of the masses or because of the mixture?
Okay, blood stagnation, why? So here, masses indicate in TCM the possibility is phlegm or blood stagnation. If there is a physical mass, so there's a myoma, those are the 2 things that we think about first. Second, there is dark clotted blood. That also shows that is blood stagnation. Third, purple tongue. And fourth, sorry, I'm moving around a lot. And fourth is the pulse is now firm. It says in parentheses, wiry at the deep level. That also, that doesn't confirm, but it is indicative of blood stagnation rather than phlegm, for example, which would indicate more of a slippery, most likely. Wiry could be phlegm as well, but we just don't have any other signs of phlegm. So yes, blood stagnation. My fourth question is where? Where is the blood stagnation? In uterus or in liver? What organ? You're saying liver. Why? Huh? Because sides of the tongue, right? That's the key answer here, is the objective signs and symptoms. It says purple on the sides of the tongue. We can say for sure it's liver. Now, I'm going to argue you can also say uterus here. Yeah, the uterus is an organ in TCM. Where are you guys from? Where did you read your books? Uterus is an extraordinary organ in TCM. If we have a physical mass in the uterus, there are herbs specifically that guide to the uterus. That's not true. There is a that's not. There are points that influence the uterus, but the other approach that we could take is we treat it as chongmai. Chongmai is the sea of blood penetrating vessel which nourishes the blood of the uterus, or something like this. So, again, in TCM there is some bigger picture. There's more than one. Sometimes there's more than one exact answer. But I would say for sure in this case you would be expected to identify liver blood stagnation because of the sides of the tongue. And why else? Wiry pulse helps support that. You could explain that in your if you were asked to justify. So yes, liver and possibly uterus or chongmai. When I said the location of a disease can be in a meridian, the chongmai is one of the meridians that penetrates. Any questions?
Right. Usually with blood stagnation, don't you get a lot more pain?
Yeah, that's right. Yeah, we would think that, wouldn't we? So the question is, for those listening online, wouldn't you have pain with blood stagnation? The answer is yeah, you often would. That is certainly one of the main signs and symptoms. If we look up liver blood stagnation, sharp stabbing rib side pain is one of the signs and symptoms. However, again, in a case study, you're not given a textbook case, right? You're not given everything here. So there's two understandings in this case that are relevant. The first one is diagnose the best pattern that you can based on the signs and symptoms you're given. So based on the signs and symptoms objectively we are given, liver blood stagnation is the most appropriate one. I would be impressed if you could give me another pattern that was better. The second understanding here is that masses, because we know that this is blood stagnation related to a mass, the mass may or may not cause pain. It's not actually in the liver organ. It is, in terms of TCM pattern, it is liver blood stagnation, but it is not the same as, for example, cirrhosis of the liver may also be liver blood stagnation, but they would have that pain in the liver organ. Here, the liver governs the movement of blood, menstrual blood, and for women, the kind of nourishment of blood into the lower jiao and reproductive organs. But the blood stagnation is related to the mass. Is it myoma? Yeah, myoma, right? So that may or may not cause pain.
What would be the TCM illness here if she has no pain?
Abdominal mass. Abdominal mass is an appropriate TCM illness. Yeah, right here, these cases you're not asked to identify because it's basically listed for you. But on the exam, in the practice, when we come back after lunch, you're going to do the practice ones, or maybe even we'll do one before lunch here. Heavy is. Sorry, I'm just reading through here. From my perspective, just having generally pain distended periods that are heavy isn't really that's not really an illness. I would want, if I saw myoma, there's a mass there. I would say so. I would say that's really the only correct answer here. Okay. Sorry, am I moving around too much? Okay. So points. So this is really, this is enough. So this is the pattern differentiation that we're focusing on here. So go ahead. So for your illness, we said illness is, or diagnosis, we'll just group the two together. What's the diagnosis here? Abdominal mass due to what? Yeah, and abdominal mass now. So from my personal, this is kind of the most basic. Hopefully you can get this. My personal preference would be to indicate where that mass is. So I'd either say I would either indicate uterine mass, because for me it does change a little bit. Knowing that it's in the uterus gives me specific information. So I would either indicate uterine, or here I may indicate due to liver, or I could say abdominal mass with, or I could say in the Chiang Mai. Mass, I want to say where that mass is, either in the uterus or in the Chiang Mai. My personal preference, because it will change the treatment a little bit. Points. Okay, blood stagnation, empirical point. Bladder 17. What else? Good. Liver 3. Ren 3 or 4. Why? Local point. So, I would say in this situation that would be appropriate. Ren 4 has a function on the uterus. You know, you could use, so Ren, I'm going to say Ren 4. Okay. What else? Need 2 or 3 other points. Anything? Move blood. We already have. Bladder 17. No Ren 17 doesn't move blood. Sorry? Liver 13 or 14. So I'm going to say no in this situation. Spleen 6 might be a little bit better. Spleen 6 does move blood and is commonly used for these kinds of conditions. I'm going to put a few other options out there. Spleen 10. Spleen 10 is probably more important. You know, spleen 10 is, the point name is shui hai, it moves blood in this region. So it can be useful for blood stagnation. The other possibilities here would be the Chong Mai points, which would be spleen 4 plus PC6. I mean, that's a good amount of points right there. Could we add back shoe point of the liver, bladder 18, possibly? You know, that would be appropriate too. Is that you know, this is kind of a lot, but this is actually what I would probably do in that kind of. This is an excess case. There's no need to tonify anything in this situation, or even. You could do even stimulation on some of the points. You could do even or reducing. Most of them would be reducing. Move blood. Yeah, that's right. You know, with some consideration, I might say like you know, not if she was having heavy menstrual bleeding, we wouldn't want to move a lot of blood during that time. You know, but aside from that, basically. Okay, so sorry, I kind of skipped a step here. Let's go to the treatment plan, because there is a little bit specific treatment plan. So the diagnosis we said is abdominal mass due to liver blood stagnation. So what is the treatment plan based on that? Move blood where? Exactly, liver blood, move liver blood. And break down or disperse the mass. And the reason I kind of want to add that here is because there are specific herbs. It doesn't make as big of a difference with the points. There aren't really points that specifically break down masses systemically. However, we would generally needle more locally around a mass. So, you know, but for herbs, it does make a difference. We would choose herbs that actually break down a mass rather than moving the blood in the liver alone. Okay? All right. Herbal medicine. So what herbs would be appropriate here? Shaofu Juyutang. Yeah. So the basic formula for blood stasis in the lower jiao is Shaofu Juyutang. Okay. I will spell it out for those of you at home or online. Shaofu, S-H-A-O. Second word, F-U, Juyu, Z-H-U, U-Y-U-T-A-N-G. Shaofu Juyutang. Okay? Good? It's myoma. I mean, it says here, in this case, it says it. So, yeah. Question from online.
Why not using
Guiji Fuling? Because there's no dampness here. So, we could use Guiji Fuling Wan, but this is, you know, we use Guiji Fuling Wan specifically for what? For fibroids, right? There's a common famous formula for fibroids, but the pattern that Guiji Fuling Wan treats is damp and blood stagnation in the lower jiao. In this situation, I mean, we just don't have a lot of we don't have a lot of data here. We don't have a lot of information in the case. They don't give us a lot of signs and symptoms. I don't see, it's hard for me to say for sure, but I don't see any signs and symptoms of dampness here, and I think that Xiaofu-Juyutang may be a better objective treatment based on the signs and symptoms that are given. That's kind of the only way I can answer that. Right? Oh, sorry, the screen is not on. Is this what's happening? Just went to sleep? Okay. All right. I mean, as you can see, it's 12 o'clock. We're definitely not going to have time to go through all the cases that we have prepared, which is fine. You know, it's good practice. So, but let's do at least one or two more of these, and then we're going to shift. At least do one before we take lunch of the practice case studies, and then when we come back, we're going to do the practice case studies, which, you know, essentially we want to run like you were taking the exam. So I'm going to have you actually do the whole thing when we come back. But let's do a few more of these just to reinforce. Case 18.1. Can I ask the people in the room, is it helpful when I go through it out loud with you, or is it like, do you want to practice doing it on your own more? Like, I'm not quite sure what you need. You like it out loud? Couple minutes? Okay. So take 1 minute, read case 18.1 on your own. Go through it. You can follow the same model that I asked you for the last one. You know, and if you have a hard time formulating a TCM diagnosis, you know, go back to this idea of keeping it really basic. First do 8 principles. Second do, you know, if it's exterior, then, or, you know, interior, then look at what is excess or deficient. If it's exterior, look at what pathogen is present. Don't answer me. Don't call the answer out in the room. Don't ask. We'll talk about it. So again, did everybody have a chance to read through it at least on your own? Save my voice a little bit from reading it out loud. Okay. So the first thing that I'm questioning when I read the first line, or sorry, second line, second sentence, started suddenly in autumn at the time he had fever and nausea. So the first thing in my mind, the onset, what is the cause of the disease in this case? Exterior, exactly, good. So my first thing in my mind is the pathogen still exterior or not? You know, but I'm thinking about that. Even though it was 2 years ago, it is theoretically possible, but unlikely. You know, 2 years. But at least I can identify, and indeed, when you're writing your case, I would say, you know, that the diagnosis sometimes will include that this, you know, was caused by summer heat or something like this, residual summer heat or something like this. Okay, you know, I have to think about that. I have to be aware of that. Fever, nausea, you said you weren't sure what it meant to be caused in autumn. Now, it is a little bit weird because in terms of the seasons and the pathogens, normally dryness pertains to autumn, but the difference between what we call late summer and autumn is maybe a little bit gray here. So theoretically, we say summer heat, the time of summer heat, which is your typical cold and flu, stomach flu, which is what this sounds like, is supposed to be late summer. So maybe there's a little bit of a discrepancy there between late summer and autumn. Now notice I didn't highlight that he was prescribed antibiotics, but they didn't help at all. The reason I didn't highlight that is because it doesn't really change my diagnosis, my TCM diagnosis. It informs me because it's probably not some kind of like food poisoning, or it's not some, it's not a bacterial, right? I mean, that's really what it tells me. Okay, his bowel movements 3 to 4 times a day, very loose with some cramping. So what does that tell me? Anybody? Well, it tells me, yeah, I mean, it doesn't tell me that much actually. No, it doesn't tell me a whole lot. It just says it's telling me the nature of the diarrhea. Always loose. So loose stool diarrhea by itself, we could say could be what? Damp cold, damp heat, could be spleen, qi or yang deficiency, kidney qi or kidney yang deficiency. These could be causes of loose, loose stools. But because we have cramping pain during evacuation, it is more likely that it is the excess pattern. So either damp cold or damp heat. All right. We also know because of the pathogenesis that the onset was an exterior pathogen, that this is not a chronic kidney yang deficient diarrhea. So we can assume that this is either damp cold or damp heat, a residual pathogen from an exterior invasion because of the cramping here. Well, remember that it specifies at that time he had fever. So the question, sorry for those of you online, it's not normal for me to lecture and have to remember that people are watching that aren't in the room. So I'm sorry, I keep forgetting to repeat questions. The question is, could we say it's heat because of the fever? And my answer was no, we can't say that for sure because 2 reasons. One is the fever is past tense, so at the time he had fever and nausea, but more importantly is that fever is present with cold or heat, right? Fever is the body's immune response. So when we have wind cold or wind damp, we also have fever. So it's not enough to differentiate here anyways. All right, 3 to 4 times per day. He also suffered fullness and distension. Okay, feeling of fullness and distension. What does that tell me? It tells me that there's some kind of obstruction, right? It tells me that there's some kind of stagnation or obstruction. Okay, what is stagnated or obstructed here? Well, I've already said that it's probably due to the exterior pathogen. So it's either dampness or damp heat. It's not going to be heat. It's not going to be cold. We don't have any signs and symptoms of those. Does that make sense? You guys following my thought process here? His appetite was poor. So again, dampness and damp heat can enter the spleen and stomach system, right? They easily obstruct and hinder the digestive system, so it's common to have a decreased appetite. His head felt muzzy. So these, and his thinking was foggy. These are signs and symptoms of what? Dampness. Sometimes it could be phlegm, right? But so far I don't have any other signs of phlegm. And phlegm is not caused by exterior pathogens. So those, the muzziness of the head and the foggy thinking, heavy body, these are all signs and symptoms of dampness. So dampness is still present in the body, right? Dampness. Next line I get to red tongue, thick, sticky yellow coating. Now, this is helping me decide between damp heat and damp cold. If it was damp cold, the tongue should be pale or blue, swollen with a white sticky coating. For here, in this situation, it's red with a sticky yellow coating. This indicates damp heat, okay, or summer heat, actually. It could be damp heat, summer heat. Pulse was slippery, just showing dampness. So that's my thought process. My next job from that place is to write down, make sure I can identify the disease is really easy here, or the illness is what? Diarrhea, it's already listed. What is the pattern is what? What's the cause of the diarrhea? Okay, damp heat. Okay, That's good. So that's pretty in the department. My preferential wording here would be residual damp heat, right? Residual summer heat in the spleen and stomach would be my preferential diagnosis. And the reason I'm saying residual is because it's been 2 years. So, and because there is no longer fever, and what was the other sign and symptom here? No longer fever and nausea. So really now we just have diarrhea, fullness and distension, poor appetite, muzziness of the head, and then we have a red tongue with a thick, sticky yellow coating. So, you know, again, very important in this case to differentiate the onset symptoms from the current symptoms. Question. We just, okay, so the question is, if it started as damp cold and transformed into damp heat inside, would we still label it as residual? In this particular case, we just don't have that information, so there's no reason to ask that question. Okay, well, okay, so no, in that situation, I would specify cold damp or residual cold damp transforming into damp heat. If that was what was indicated, I mean, I would write that. You know, you'd have to have some fairly specific pathogenesis, fairly specific onset symptoms, and then current symptoms to kind of show that progression to write that. Damp heat in spleen. Yeah, spleen, you know, we could say in middle jowl, which would include spleen and stomach, the importance of the spleen here. I don't know why it keeps sleeping so easily. Does that bother you guys? It bothers me. The importance of the spleen here is the heaviness of the muscles. Where is it? Or I guess his body feels heavy. Yeah. So there's nothing real super specific. I would probably just say middle jowl. You know, yeah, spleen, stomach. You know, we maybe don't even need to say stomach because there's no more nausea left. So, but because I'd say either is okay here. I don't think it changes our treatment much. Any questions on that? Does anybody have questions on that? Anybody online have questions on that? Okay. Treatment plan? Treatment principle? What is the treatment principle for this case? What do we do? I like summer heat better in this case. I'm going to use summer heat instead of damp heat. Okay. I don't know. It's really, maybe damp heat is, I don't know. Anyways, resolve summer heat, damp heat in the middle jowl, right? I mean, that's how we're treating this. We could add and stop diarrhea, right? What is your treatment? Acupuncture points, stop diarrhea, resolve damp heat in the middle jowl. 6 points. No. Stomach 25, yes. So again, chief complaint, diarrhea. How do we address diarrhea? Important. Stomach 25, front move point. Stomach 25. Okay. What else? Good. Spleen 9. So when we say damp heat, you know, is less than spleen 3, which is more tonifying. Spleen 9 resolves excess dampness a little bit better. What else? Bladder 25, we could use. I'm going to put a primary and secondary. UB 25, okay. You also said UB 20. I'll add that there. Ren 12. So we could use that, but it's not as important as it was with epigastric pain because the chief complaint is diarrhea here, right? Stomach 36 or 37? So everybody knows stomach 36, but stomach 37 is better. Why? Yeah, because it's the lower hussy point of the large intestine, so it's better, a little bit better for pathogenic invasion diarrhea. We use this a lot. So stomach 37 is great. I like that. What are other? You said stomach 36. The reason I said because this is mostly a tonifying point. We don't really have a lot of deficiency here, right? That's what I'm trying to, get you to see in this situation. What else? Is there anything else? What else is maybe important here? Well, sorry. Again, you're thinking of you're trying to tonify the spleen and stomach. We want to resolve dampness. You said Ren 12. Let's put that in. Ren 9 is good. I like that. As a water. Yeah, this is more for phlegm. We don't normally use this for damp heat as much. Doesn't, we could use it, but it's not as good as this, I guess. Same thing with stomach 36. It's like, which is the better point? I like that. This is a good treatment plan right here. Yeah.
Don't want you to think I know what I'm talking about here, but
It's okay.
I'm just reading from the book. CD8 with moxibustion to warm and reinforce the original yang.
Is this yin or yang? Is this a heat or cold?
So you don't want to do that.
Yeah, so Mox on Ren 8, or even Ren, we could use needling on Ren. I mean, basically we don't want to, the goal here is not to warm up a lot, so I probably wouldn't choose Mox in this situation. And of course we can't needle Ren 8 because it's the navel.
Strengthen the body constitution and stop diarrhea.
Yeah, so this is more for spleen or kidney yang deficient diarrhea to do Moxa on Ren 8. Moxa on Ren 8 we should not do in this situation. We could also use potentially Sanjiao, like a Sanjiao point, Sanjiao 5 or something. We could also possibly use Li 11. This is because we have this kind of, it's basically damp heat, right? You can use Li 11 we commonly use. You can think of that. And as a large intestine, diarrhea is the chief complaint. Okay? Any questions? You guys getting the flow a little bit? Okay, what's your question on stomach 36? We can use it all the time. That's the problem.
Well, sometimes you say, no, it's mostly a tonifying point, but then sometimes you say you're not tonifying, and I'm finding that.
Okay, the stomach 36, I mean, it's such a big point. It's like the most commonly used point in TCM. It's very much a tonifying point. I mean, it's one of the really important points for tonifying systemically, specifically post-birth chi in the body, because it's the earth point on earth meridian. So it allows us to gather nourishment from the food energy that we eat. But the other category that point is in, we say it's a command point for the abdomen and stomach area. So when we have signs and symptoms specifically like, how do we say, like specifically things like epigastric pain or something, it's like the strong, everybody knows when you needle stomach 36, the patient goes, wow, is like a strong moving point. So when we have pain in this, we say it's the command point for the abdomen. So it kind of guides or has a strong effect on this part of the body. Diarrhea is not so much a problem of the abdomen as a whole so much as it is the pathogen that's present, which is why I put it as like it's not like a super important point in this case, where I said yes, that is important in whatever other case. And in fact, I think of the one I said it was really important was not the epigastric pain due to excess, but the yang deficiency. I said, well, this is primary because of the deficiency there. It can be used for lots of cases and in clinical use. But you want to demonstrate your understanding a little bit by like not using, stomach 36 for every case you're given. Well, diarrhea due to excess, we generally don't. Well, I shouldn't even say that. Sometimes we could, but 37 is often preferable when it's diarrhea due to excess, so a case like this. You can use it in most deficiencies that affect the digestive system, whether it's Qi or Yang deficiency is often, an important point when it's symptoms, of epigastric pain, bloating, distension, or diarrhea. I'm not going to say when you shouldn't use it. Like, it's more a question of of all the points that you're going to write down, which ones are better. All right. Okay, so I'm going to pause there, and instead, so let's actually, I'm a little concerned about time. How are we going to do this with time? Maybe we have 6 cases. Okay, so everybody have the printed, do you guys all have the printed versions of the cases that we passed out? So the first one says case study 1, 1-X, and it says manic depression, right? Has been diagnosed as manic depression. Okay? So what I'd like you to do is, I'm going to give you 5 minutes to read. Well, no, actually, I'm going to give you 10 minutes to do this case. So this is male, 27 years old, has been diagnosed as manic depression. So, yeah, that should be. Okay, yeah. So, and I think everybody at home, those of you that are at home have this. Maybe Melinda can show you or say the name of the file again, whatever that was that you opened. Yeah, take 10 minutes, go through, write down the illness, syndrome differentiation. I want you to write down and explain the reason for your diagnosis, treatment principle, and treatment plan. Okay? Maybe I'll give you more like 15 minutes to do this. I'll check in 5. How's everybody? On? Microphone check. Everybody done? Have you chosen your points yet? Okay. All right, so let's kind of start to move a little bit. Male, 27 years old, diagnosed with manic depression. Again, depression is not something that we covered specifically. It is, however, one of the conditions that's listed under the long list of CTCM PAO diseases. So you should, be aware a little bit of, what manic depression is. But his chief complaint was headache or hot sensation. Okay? We have to take everything that we get with a grain of salt, and we have to try to make use of it. All right? The history of the present illness. Overexcitement, insomnia, incessant to fast talking when he was manic. So Based on the information that you have so far, what are you thinking, right? Excess condition and what? Interior, correct. And what else can we say? Is this heat or cold? Heat. So based on 8 principles, that's where I'm at. Internal excess heat. Now, I also have some, we say overexcitement, insomnia, and essentially manic depression is like a mental disorder. So in my mind, I'm assuming, or I'm also thinking about the heart, okay? Avoiding working, being tired, and fear of failure when he was depressed. So there's a little bit of a back and forth here, which is indicative of a liver pattern, which often kind of goes back and forth, right? Symptoms that are described by the patient. Insomnia. Insomnia with these signs and symptoms likely further supports the idea of heart heat. Inappropriate laughter. This is really kind of confirming, again, it's like we have, well, maybe it was a liver, but now we have like quite a few signs and symptoms of heart. Laughter, joy, excessive joy. Laughter is the sound of the heart. Abnormal manic laughter in this way really indicates a heart heat. Irritability, that to me indicates heat. Yeah, but could be heart heat as well. That's the issue. It doesn't really confirm liver, but I still have in my mind it could be, it's definitely heart is affected, possibly liver is kind of what's in my mind right now. Incessant to fast talking, that also indicates heat in TCM. There's a red facial complexion, again, confirming heat, confirming excessive heat, because it's not otherwise indicated deficiency. And then there's some correspondence, or again, a relationship between the facial complexion and the heart. The heart governs the facial complexion. Talkative with a loud voice. What does that indicate? Why liver? No. Excess. It means it's excessive by nature. It doesn't mean for sure that it's a liver pattern. Excessive and loud voice indicate excess condition, and yeah, it could be liver, but it's not necessarily. Red tongue with a thick, greasy yellow coating. What does that indicate? Heat and phlegm. Blood? Blood? Red what? Red means heat, not blood anything. Red indicates heat. Greasy yellow coating indicates phlegm, heat. Yeah, phlegm and heat, okay? Forceful pulse indicates what? Excess. Forceful, excessive. Full, excessive. So forceful and full pulse. Based on the information we have so far, we could expect a rapid pulse. If the pulse was wiry, then we might confirm, or it might help us say, well, maybe this is heart and liver heat here. But what pattern? If I had to choose one Zong Fu pattern that most appropriately matches this, what is it? Why? Okay, so phlegm heat, not obstructing but misting, yeah. Oops. So the best diagnosis here is phlegm, heat, misting, heart. So, if I have to think, is this liver heat? Okay, is there liver heat is the second question that we've been talking about. Who wrote down that there was liver heat? Why? Okay. Okay. Did anybody else write down liver? Why? Tell me why. Don't make assumptions. So we can't assume he has high blood pressure. But what symptom that is written down made you think that? There is one. A headache. All right? So this is the one symptom that really isn't normally explained by phlegm, heat, misting the heart. Irritability can be explained by this. This is definitely, like, irritability is a heart heat thing. People with heart heat are irritable and agitated, and, you know, really we have manic depression, we have a Shen disorder. This is definitely the primary pattern. Question is whether or not the liver is also involved. And because there's headache and this heat feeling in the upper, maybe there is. You know, because that's not normally present here. But this is really what you should be seeing. If you didn't see this, the liver doesn't matter, in my opinion. So the question is, because of the fear, is there anything related to kidneys? Are there any signs and symptoms of kidney disorder? Of a kidney, you don't see it. So then no. Okay, I mean, there's not really enough. There's nothing else to say kidney problem, so we can't make that assumption.
I know you said that headache indicates liver, but does it also where the headache is?
Yeah, so we don't have a lot of information here, right? We don't have a lot of information here. So it doesn't say where it is. It's just all that I can say is that's the one symptom that's not really explained by this, because normally phlegm, heat, misting the heart wouldn't have a headache.
I was under the impression that people who are agitated, irritated, and get into an argument, loud speaking, yelling, liver yang rising.
Okay, so if I pull up the case, see if somebody actually has. Can I borrow your book for a second? Is that okay? All right, I'm just going to read the pattern of phlegm, heat, misting the heart. If I can find it in here, let's see. So again, my question to you was, what is the most appropriate diagnosis? All right. If I read phlegm, fire harassing the heart, derangement of the mind, mania, incoherent speech, mental confusion, aggressive, violent behavior, tendency to hit or scold people, uncontrolled laughter, crying, shouting, or muttering to oneself. The key point here is that it's a mental disorder, and that is a Shen disorder. So, you know, that's why the heart is more important than the liver here. If I read, so that's part of it, and then if I go on, I also have insomnia, dream disturbed sleep, flushed face, coarse breathing, constipation, yellow urine, sticky yellow tongue coating, slippery, rapid, and full pulse. That's the textbook pattern. Of course, we don't have that here, right? This is not a textbook. This is a case. If I look at liver fire, let me just find this here. Liver fire, so that's kind of what the other option was, a liver heat condition. Is that what you, more or less what you said too, liver heat, liver fire? So we have distending pain in the head, temporal headache, dizziness, vertigo, red eyes, swelling or pain, tinnitus like the sound of waves, irritability, outbursts of anger, dream disturbed sleep. This is what that part is talking about. But both of these patterns have this kind of emotional disturbance present. And in fact, I would argue that based on what's written here, the phlegm misting the heart is more closely related to what we see. But both of these could cause that kind of emotional disturbance. Is that fair? Do you guys see what yeah.
When you go to the headache section of this stuff, there is no mention of the heart or phlegm.
But this is not, that's the thing, is that's what I'm saying. Like, headache is the thing that doesn't really match the phlegm heat misting the heart. And so I question, but to be honest, it's not even that important, because the primary pattern, there's no wiry pulse, there's no red eyes. The primary pattern is definitely this.
So if you go along the headache pattern,
Yeah, that's right. Yeah, I would say so. If you follow the headache, if the headache is the first, um,
See, chief complaint.
chief complaint. So this is okay. All right.
I asked that question in the morning. Should you look at the first complaint that's mentioned, and that could lead to a stray.
Right.
I guess you can't just look at the first.
Oh shoot! I don't even.
You definitely have to look at the other stuff. The pulse. Could you
I don't even have
liver fire?
it. So yeah, could you add, would we add or could we add liver fire? I'm actually looking for the answers, but this is the one that I don't have the answer downloaded, so I can't even check it for you. I'm going to say yeah, that would be the secondary pattern. Would be liver. Do we have constipation? Do we have thirst? Do we have so? Right. So my question is this a liver fire or liver yang rising? Because liver yang rising would be a little bit of a headache. You know. Well, that's the issue is if we don't have a. I'm going to say liver heat.
Basically, what you learn from this is you don't just look at headaches. You've got to go through the whole thing.
You have to choose the most appropriate pattern.
Because that is not really a headache.
Yeah. I'm really inclined to say that this is still enough here. That this is I just don't think I want to treat liver without a wiry pulse or without one other sign of liver pattern. I'm focused that this is enough for me.
So if we had depression, if depression was one of the diseases in phlegm invading the heart.
Is a possibility, but let's be clear, this is manic depression. So it's a little bit different, right? So sorry, for the people online, the question was, if we look up depression, will we find phlegm heat missing the heart as a pattern? My answer was, well, remember this is manic depression, so phlegm heat is generally an agitated manifestation, which would be more like a manic depression than kind of textbook depression, in which case, yeah, you would absolutely see phlegm heat misting the heart, and phlegm misting the heart are the two primary psychological patterns. When we have what we call a Shen disorder, mental disorder is usually the phlegm misting the heart. At least that's a component of it. So, yeah. Treatment plan? Good. Hang on, a little bit slower there. I'm changing the wording a little bit. So I said transform phlegm heat in the heart and pericardium, actually is what I said, because it's not just the heart, it's the heart and pericardium here, and calm the Shen or calm the mind. The important thing here is the mental agitation, adding the calming the mind. Okay?
Pericardium more involved with the actual heart kind of problems, not so much the Shen side of it.
The pericardium is the protector. So what that means is that what that means in kind of practical usage is when we have excess conditions, specifically of heat, that often the pericardium is being used in treatment, and pericardium does play a role in the mental state. So when we have like blood heat in the pericardium or something, we have a lot of the Shen mental agitation. So I'm adding pericardium here because it's an excess heat condition, and because I want to use pericardium somewhat to treat, I would think of using that. And when we have, if you can kind of think of like the phlegm misting the heart as a pattern, it's the pericardium is is between the phlegm rising up and the heart itself. So the pericardium has some effect here. But yeah, mostly it's the heart. It's also because of all this heat. Yeah. Okay, what's your treatment here? What points do you use? Do 20? Okay. So again, think about first start with what's our main thing that we want to do. What do we use to transform phlegm heat in the heart? Heart 7. PC6. Okay. If we wanted to get real, yeah, if we wanted to get real like strong with it, we could actually say like, okay, we could use PC. So actually, I'll go real extreme here. We may not use this in clinical, but I'd say PC8, Lao Gong. This is to clear heat from the pericardium and opens up the orifices. PC8, okay. We could use, you mentioned Heart 7. We could use Heart 7 and PC6 as well. I mean, PC6 is probably what I would use in clinical practice. We could also use Heart 8, which again is a heat clearing point. So, my idea here is definitely want to clear the heat one way or the other. Whether we use pericardium 8 or Heart 8 here, it's a stronger heat clearing point. Again, patients often, they're very strong, so they're on the hand. These are the only 2 points on the palm. It's very, very sensitive. Sometimes we can't do it, on a patient. They're too sensitive. So what other points? Dampness or what? Phlegm. Yeah, what point? No, that's for dampness. Stomach 40. Empirical point for phlegm. Okay, what else? So now we're really dealing with this, the phlegm heat in the heart, I've kind of dealt with. Calm the Shen. So now what points were you saying? So you're suggesting do 20 by Hui or do 26? Pretty strong. Okay. Yeah, this we could do 26. We could also use, I would probably look at do 24 or Yin Tong as an option. I mean, really, so do 20 could be used. It's also because there's headache. This may be useful. Do 20, 24, something like this. Yin Tong. Now, we don't know where the headache is, so it's kind of why it's a little difficult to choose. Like if it was a frontal headache, we'd use these points. If it was a temporal headache, maybe we use Taiyang, the extra point here. If it was an occipital headache, maybe we use GB20. You can't say 100% sure without knowing more information, but based on the information we have, do 20 is like these points serve 2 functions. One is calming the mind and Shen, and 2 is addressing the headache itself.
The difference between phlegm and dampness.
Phlegm is substance. Okay, so in this case, I'd have to pull up other notes to kind of go through the types of phlegm. But remember, we have different types of phlegm in the body. We have phlegm damp, phlegm heat, phlegm fluids. Okay, I could maybe write these down if you want. But then we got to go to lunch. Okay, phlegm damp, phlegm heat, phlegm fluid, okay, phlegm misting. Oh, sorry, we have misting heart. This is a separate type of phlegm, and this can also be heat or cold type. These 3 are substantial phlegm. Okay, so these 3 are actually like rheum that you cough up. When we say phlegm heat in the lung, the nature of it is yellow, sticky phlegm that's difficult to cough up. Phlegm damp it was first, but phlegm damp is white, profuse, easy to cough up. Phlegm fluid has watery, gurgly sounds, a lot of water mixed with phlegm. Okay, phlegm misting the heart can be heat type or cold type, and this type is heat type. This is actually invisible phlegm. They may or may not have any substantial phlegm, tan, right? Room. It's like what they're coughing up. They may or may not have it. This is this is indicating the mental disorder. So when we say misting the heart, we literally mean basically an obstruction of the mental, the shen, the mind spirit. Okay. The other types, we also have qi phlegm. Qi phlegm. We have phlegm in channels, and then we have phlegm mass. Trying to think if there's any other types. I'm sure I'm missing one or two here. Oh, phlegm wind. Okay. So qi phlegm is mei he qi, which is a plum pit qi, is a feeling of qi stagnation, and it's just like something, it feels like something stuck. We literally say a feeling like a plum is stuck in the throat. Mei he qi is qi stagnation and phlegm. Phlegm in the channels is numbness in the channels, a numbness along a part of the body, okay, which has a certain quality to it. I mean, not all numbness is phlegm, but again, this is a real fast kind of overview. Phlegm masses would be any kind of mass. We said today the cases we looked at were blood stasis. Lipomas, for example, would be a mass caused by phlegm. And then phlegm wind is like dizziness or tremors, wind in the body that is aggravated or agitated by phlegm. So these are all types of phlegm. All right. Dampness, yeah, dampness is a whole different category. All right. So phlegm, we kind of say that phlegm as a pathogen, as a substance, we can sometimes categorize it under the umbrella of pathogenic dampness. It is a damp-like pathogen, but they are different. Phlegm is always a foreign substance that's not supposed to be in the body, and phlegm does not come from exterior pathogens, right? Dampness is kind of a normal substance that is, it can be a normal substance. So for example, if we have the spleen deficiency, that can produce dampness in the body, or it can produce phlegm. Phlegm has to be broken down. Dampness can be drained out. We can get rid of dampness through increasing urination and bowel movements. Phlegm cannot be urinated out, okay? Well, all phlegm is not dampness. Like I said, phlegm in a very general sense can be classified as a form of pathogenic dampness, but we separate dampness when we diagnose as dampness. It's not the same as diagnosing as phlegm. A lot of the signs and symptoms may be similar. Okay, question. Heart, small intestine, what is that, 1? Can you do bloodletting on small intestine 1 for this patient? Yeah, you could do that. Sure, it's a good option. Bloodletting on small for this patient. What do you think? You don't know? You thought it was liver fire, so you're going to use like a Longdan Shiagantang or something? What's that? Guipitang, no way. Oh, no. Guipitang, no. This is tonified chi and blood. What? No. What is the correct for me? I want to check the answer when we come. I want to go. Let's go for lunch, and then when we come back, I'll actually just double check the answers on that one.
If you were to answer liver fire, my answer,
yeah,
it would be marked wrong.
I would mark it wrong if I was grading it. Yeah. So each section, each section will have like so especially in these cases like maybe some situations you might even end up doing the same treatment or choosing the same formula, but the diagnosis is wrong, or the diagnosis is right, but you're choosing like an unoptimal formula, or the formula is wrong. So for me, it's like I guess that I would give partial credit if you, like, let's say you were correct in terms of a general diagnosis and your treatment plan was going to benefit the patient. I may give like a partial credit or something like that. But if you just said, in this case, liver fire, you didn't identify anything else, I'd be like, it'd be hard for me to get, if you said liver fire harassing the heart, and then you were using a heart point and calming the shen, then I'd probably give you partial credit. Something like that. Another question. So dampness, this is a difference between phlegm and dampness. Dampness can be an exterior pathogen. Dampness or summer heat can attack from outside, colds and flus, stomach flus. Phlegm can't. We don't get like a phlegm pathogen. That's why we say phlegm is always produced in the spleen. Question.
Why not phlegm fire? Why this thing?
So I'm not sure what the question is. Phlegm fire. Why not phlegm fire? We can call it phlegm fire. Phlegm fire harassing the heart, phlegm fire misting the heart is the same pattern, different terminology. But it's the same pattern. Is that okay? Good. One more question? Yep. Well, yeah. Could we use liver 3 in this case? Yeah, you could add that, but I mean, even based on what I see here, principal points for anxiety, depression, and stress. So we do have depression here, right? Principal points, do 20, do 26, heart 7, PC 6 are the first 4, and then liver 3 is added. So I would say if you chose that, you'd be on the right path at least. Right. All right, guys. So we're going to take an hour for lunch. Come back at 2. Fresh brain. So we're going to do more of these. All right. Everybody back online? Is everybody back? Okay. So we had one question online about what reference books are good. There's, this is the easiest and shortest one. This is, I had written on the board, but now it's erased. The mini handbook of Oriental Medicine. I don't know, can you see that? Okay. Mini handbook of Oriental Medicine. Should I just write it on the board? Okay. It's H.B. Kim. So this is the mini handbook. I'm going to actually focus on this one because if you're going to buy one, I would get this one, which is the full handbook. This is the North American, or NCC, originally it was an NCC AOM, North American, or whatever, the U.S. board exam prep book. So it's basically summary charts of everything in TCM, including herbs, formulas, diagnosis, points. There's a lot of good summaries of like talking about safety stuff, point depths and angles. There's like a 2-page summary chart of that. It's a lot easier to study or review based on this. So, Handbook of Oriental Medicine by H.B. Kim is the author. Handbook of Oriental Medicine. And then his other one, which you'll find if you look for this, is the mini book, which is just a pocket version of the same one. So, if you're trying to think of, this is really, we use this in student clinic as like a quick reference. You need to quickly look something up.
Is that K-I-M?
K-I-M, yes, Kim, Korean. Sure. So this is a good, excellent kind of reference book. It's kind of like a desk reference or something. The other book that is probably most useful for this particular Pan-Canadian, or sorry, this is not Pan-Can. This is PLAR case study. Would be this is one of 3 volumes. And again, last week I brought this in. Yeah, that's right. There's 3 of these. So clinical handbook of internal medicine. Right? So this is volume 2. Anyways, there's 3 volumes. So this is much richer in information than the handbook is, right? Then versus who has the handbooks. This one is, yeah, that one. This one is actually has a lot more information and very specifically, you know, similar to what we're doing, but it's a big course, right? It's a lot of content in this course. It also has herbs and acupuncture, pattern differentiation based on the disease presentation. Sorry, author is McLean and Littleton. Author by McLean and Littleton. Will McLean and Jane Littleton. Okay, was there another online question? Anything else? Oh, McLean. Hi. All right. Was there any other? Melinda said there's a couple of those. Okay. So we have 3 hours left. Let's start going through. Anybody have any more questions on this case? This last one that we left off on? Not so much. All right. Let's go into the next case. I'm not sure if I have them in a specific order. I don't know if they gave them to you in an order, but this is which case is this? Female, abdominal pain and distension, constipation, more than 1 month. 4, age 4, child. So again, I'm just going to give you time, and basically what I'd like to do is I'd like for you to do these cases on your own under a little bit of time pressure. So 10 minutes starting now to write everything. It's a little bit less time than you'll have in the exam, but I want to put you under that time pressure to make you work. So 10 minutes starting now to write down everything, including your treatment. 40. Change it to age 40. Yeah. I'm also just looking. Yeah. This change it to age. Okay. Are we done? No, still not done. I even gave you 2 extra minutes. All right. So let me just put this overhead back on. There we go. Okay. Why are we not on overhead? Yeah, there we go. So what I'd like to do, how many of you wrote down a diagnosis? Great. Starting with you. Go ahead. Give me your diagnosis.
Possibly abdominal pain, but I couldn't find that as constipation.
Or constipation, which, okay, all right. Okay, due to?
There's more symptoms than just the constipation, but there would be either.
Due to what's the TCM pattern?
That's where I go. Okay, so there was liver symptoms, such as chest and hypochondria.
Okay, I don't want symptoms. You either do or don't have a diagnosis. I want a diagnosis. Who else? Who has a diagnosis? Okay, abdominal pain due to chi stagnation. Okay. Anybody have? Due to liver stagnation. Okay. Okay. Oh. So you said hypochondriac pain due to liver stagnation. So that's a different. So what? And illness? Which one did you? Constipation. Constipation caused by. Sorry, just repeat it one more time. Liver overacting on spleen. Constipation caused by liver chi overacting on spleen. Okay. Anybody have something different? Okay. So abdominal pain caused by damp heat. Okay, so before I even look at the case, I actually haven't even read the case. I mean, the last time I taught this workshop I did, but I don't really remember what it is. So before I even look at that, I'm just going to point out some issues here. Specifically with this one, and just saying chi stagnation doesn't indicate a where. So ideally, if you say liver chi stagnation, at least you're indicating an organ involvement. So in terms of treatment, we need, you know, okay, if I'm going to choose points that move chi in the liver are going to be different than points that move chi in the stomach and spleen. You know, I will choose a different meridian, and I will at least be able to justify my treatment based on the signs and symptoms that they present and the diagnosis I gave. So I would, you know, just to keep that in mind, try to identify, once you identify it's chi stagnation, try to identify what organ, you know, what signs and symptoms are there here. It looks like we have quite a range: abdominal pain, constipation, or hypochondriac pain. Okay, what is the okay, chief complaint is abdominal pain and distension constipation for more than 1 month. Okay. I might write both down. If it was presented like this, I would write, I don't know how many of you did that, but I would probably write down both. Neither one of those seems, unless there was you know, I would write basically what's written in the main medical complaint: abdominal pain and constipation. Unless the constipation was specifically long-term, like, you know, hasn't had a bowel movement for a week, in which case I would focus on that as being the most severe of the illnesses. Okay. Yeah. Okay. So as we go through, if I go through thinking about diagnosis, due to working distress, had chest and hypochondriac pain. All right. Well, now due to that, I want to make there's a okay, but then so you know, question in my mind again, the red flag: chest pain. Is that like something I have to be mindful of? But the situation was relieved already after using a little bit of Huoxiang Zheng Qi San, right? This signs and symptoms we don't need to worry about then.
I have a question. For people that don't know what that curve is that a clue that we're not going to get if we don't know what it is?
They couldn't for an acupuncture exam. They couldn't require that you know that. But actually, it doesn't matter to me. The key point is that he doesn't have those symptoms anymore. It doesn't matter what it was, what the formula treated actually. But the fact that I'm separating, okay. So now what is currently described: constipation, abdominal distension, and pain while discharging. So this intended to discharge but failed to discharge any stool out. What is that? How do you interpret that? What is the meaning of that in TCM terms? Like, you know, it's like you have a desire to go, but we can't go. Okay, or a lot of gas, and then dry stool that is discharged forcefully. Okay, what does gas mean here? Gas is more like the dry stool would indicate a heat pattern. The gas would indicate a chi stagnation. So, you know, even in the Chinese term, we use the term qi all the time in the West as like energy, you know, this, but actually in Chinese language, often this means like the same character is used in like gas, right? It's like a qi, it's like a bad qi, okay? So dry stool, well, that's what my thought is anyways, right now as I read through this, is dry stool, constipation, possibly heat. Sometimes the stool was firstly dry and then loose, so this is common with what? Damp heat, actually. You know, the heat part will dry it up. Could be liver stagnation as well. We haven't got there yet. Bitter taste in the mouth. Bitter taste could indicate a liver, you know, it's like bile, liver pattern. Tongue is pale red, huh? So who said earlier, like, what the heck do they mean by that? How can they say pale red? You know, what is pale and red? It's almost like opposites, right? It's like, with red margins. Okay. With a white, greasy coat. Sorry? So the tongue, pale red tongue with red margins. The red margins clearly indicate liver heat. I'll write that down, liver heat. White, greasy coat indicates what? Dampness or phlegm. Damp or phlegm, you know. Wiry pulse indicates what? Liver involvement in this case. So because, you know, if we had severe pain, the tension in the wiry pulse might indicate blood stagnation or something like this, or the pain. But because we have several signs and symptoms related to liver stagnation, then, yeah, we can say the wiry is more related to the liver stagnation. Slippery also shows some damp or phlegm. Okay. Yeah, so what is that, you know, due to working distress, he had these symptoms. The fact that the onset was hypochondriac pain, so again, I crossed this out here because he no longer has this, right? So I want to take that off the table as an illness. That's not what we're treating. We'll change the formula based on the presentation of the pattern. So it's not this. But actually, you know, this is still on the table. I shouldn't cross that out. That tells us about it supports the idea that it's still a liver pattern now because the onset seems closely related to that. Started with stress, liver, you know, the big sphere of liver patterns encompasses like nervous system, stress, right? Yeah, so then the next question here is what about the phlegm or dampness? Is this something that we need to treat? Is this, you know, the other question would be how much heat is there? Because we have a bitter taste in the mouth is more common with liver heat. So I'm going to say the best answer based on what I like of these. I like this better than any of the other ones. All right, the liver chi overacting on spleen, but I do like. I actually want. You know, this is actually also very close to saying liver chi stagnation. If you say liver chi stagnation, well, I would. Let's take these two and mix them together a little bit. Which one? Which one is?
Liver chi stagnation. Sorry, chi stagnation. They didn't denote any organ.
Yeah. Here. Just chi stagnation, right? Now, my bet is that if you go into the points, they're going to treat it as liver chi stagnation. So.
Pale tongue. All the findings because there's chi deficiency and chi stagnation.
Right.
This seems to fall more in the.
So my question is not just signs and symptoms, but in terms of treatment, if they're going to change the treatment, based on chi stagnation, where is it? Where? Yeah, so liver 3 and Ren 12 to chi stagnation. So, you know, the chi stagnation is associated with the liver organ. Even though it's not written there, it's still associated with that. Now, Not all chi stagnation, but in this case, it is. So general chi stagnation is one of the responsibilities of the liver is to ensure the smooth and even distribution of chi and blood in the body. Where this case is a little bit different is because we have red margins of the tongue. So what I was going to say is if I were to reword this in, in my best case scenario, I would say liver chi stagnation transforming into liver heat because we have this constipation, right? And then, some overacting on spleen. That's how I would, because we do have a slippery pulse and a greasy tongue coating. If we just say liver stagnation, it's not really enough. So, there's some effect here on the, again, the bitter taste in the mouth and the constipation lends more to liver. We would use the term in TCM, liver stagnated heat, which means liver chi stagnation transforming into heat. Yeah, so the wiry pulse, stress onset with hypochondriac pain, red margins of the tongue, and what else do we say? Bitter taste. Bitter taste in the mouth is liver and also helps support heat specifically here. Usually we see that with heat, liver heat. Question. I might accept that if the rest of it kind of your treatment plan was okay. I think that again what I'd be looking for is did you write liver stagnation? Are you is there that's the primary? So remember, go back to what I put on the board in the beginning. What's the primary pattern here? What's the secondary pattern? Right? The primary pattern is the liver stagnation, more specifically, liver stagnated heat. Is this liver fire? No. We don't have enough signs and symptoms for it to be liver fire, but it's liver stagnated heat. Second pattern, spleen weakness or whatever that is, which is, I wouldn't really call this damp heat per se. This is a case where the dampness mixes with the heat more than damp heat.
A little bit that it's still there.
It does? Where? Due to working... Sorry, where does it say that? Due to working distress, this month experienced chest and hypochondriac pain, anorexia, eats a little, frequent burping. The situation was relieved a little bit. Oh, okay. All right. I'm still going to say that his main complaint is distension and constipation. Yeah, I'm still going to say I wouldn't identify this as hypochondriac pain. It just really supports the liver pattern. That's all. So I'm thinking like even from a biomedical perspective, right? A patient comes in, they have abdominal pain and constipation. You want to address that. We want to address the chief complaint and try to create change in that quickly, right? As we say root and branch. Branch is the symptoms, root is the cause, more or less. To keep it simply, the root is the pattern and the branch is the main symptoms as it manifests. No, you normally would not write more than one. Is it okay to put more than one? From my perspective, I would identify it based on the chief complaint. I would not write 3 or 4 illnesses just because, I wouldn't write constipation, abdominal pain, and hypochondriac pain in this situation, and poor appetite or anorexia. I wouldn't write that, right? I mean, because you focus more on the chief complaint. Okay? All right. So what is your treatment plan? What is your treatment principle, rather? So if you have stagnated liver heat, what's the main principle is to do what? Tonify or move? Move. It's stagnation. Move it, disperse it. It's stagnant. Soothe liver. We can clear heat a little bit, right? So if I were to write it, I'd probably write something like soothe liver or yeah, we could also say move liver chi if you want. We use this term soothe liver a lot, but we can rephrase that and say move liver chi. Moving chi, disperse liver chi stagnation. Disperse liver chi stagnation, soothe liver chi. And they're all saying the same thing. These are all different ways of phrasing the same treatment principle. Well, what do you think? So my question is, do I clear heat? Am I trying to clear heat from this patient? Is that part of my treatment principle? Okay. Yeah. Yeah, and so another one of the treatment methods that's important. I mean, what's more important here is actually purging. So we use, we have constipation. One of the treatment principles is essentially to use purgatives to move we have constipation with dry stool. We want to move it down. So, we could say clear heat from liver. Purge stools and tonify spleen. It's a big one, isn't it? But it addresses everything. And the thing is that we have one single formula that's meant to address most of this, which is Danzhi Xiaoyaosan, right? Mudan P plus Xiaoyaosan addresses everything except for the constipation. So, it seems like a lot, but we don't actually need to, it's not as much as it seems like written out. But yeah, we want to basically soothe liver chi, clear heat from the liver, and that's really one pattern, right? This is part of the same thing. Move the stools and strengthen the spleen, right? Does that make sense? Does that explain everything that's happening? Are we addressing all of the patient's signs and symptoms that are presenting? We are. Yeah, so theoretically, that's why from a TCM pathophysiology, basically, we can understand that the heat is caused by the liver stagnation and the spleen deficiency is caused by the liver stagnation. That is the primary. So theoretically, we could just soothe the liver and the other things would resolve eventually. But when a patient comes and they have pain and constipation, we kind of want to get that moving a little bit and deal with that. But that is why they're listed at the end. Yeah.
In this case here, should we also have some other recommendations for the patient in terms of dietary considerations, fluid intake, and so on?
Okay, so should we have other dietary recommendations in this case here? Well, from my perspective, there's not a lot of real specific. I can give a list of things, but I don't think that it's cause. So in the event of spleen yang deficiency, the cause may be closely related to diet. It's unlikely here. The only thing I would say to this in this case would be that real heavy red meats and things like that should be reduced a little bit because that will lead to stagnation and lead to heat and could aggravate it. But I don't think it's a major thing here. Usually with liver stagnation, the diet is not the main cause. It's usually the stress. So if I was to give one piece, I think about Same thing with point selection, right? Could 20 or 30 different points be used? Yes. But if you were to only use 1 or 2 or 3 points, what are the best points, the most important ones? Same thing with lifestyle recommendations. The most important one here for liver stagnation is what? Calm. So do meditation, yoga, tai chi, something like that to calm the mind and nervous system. 2 is movement and exercise disperses stagnation. So, this person probably would do well and would be their health and lifestyle, like this would improve through more activity.
How about adding Western style diet, fiber, fruit?
Sure. Yeah, you could do that. Sure.
Mix Western,
sure.
even though it may not be Chinese related in terms of fruits, vegetables, fiber.
Absolutely. I think that I'm saying that because of the cause, and so what I'm kind of basing mine on liver stagnation as a primary cause, and the fact that it started with stress, not with what they've been eating for a long time.
On the exam, if you added those, would it be marked wrong because there isn't a Chinese approach there?
I think it was
Vegetables and fiber, the way Western medicine, the diet suggestions for constipation.
So I can't say whether, if it was me and I was marking an exam, I wouldn't put any weight on it, but I wouldn't take anything off. You know what I mean? So I wouldn't, from a Chinese medicine perspective, absolutely it is important to have a diet that's rich in these things: fiber, vegetables, fruits, whole grains, whatever, all of these things that help to, keep the bowels moving. That's kind of a normal and healthy diet. So you could write that, but again, this is the main cause because it's only been 1 month ago, right? It's only been a month, so it's not likely, like he didn't say anything about 1 month ago changed his diet and then, So it's from my perspective, it's not an important thing, but I certainly wouldn't take off if it was me. Okay, treatment plan. What's your point selection? Liver 3, good first choice, right? Empirical. Ren 12, okay. Who else has something? What else did you write down? Su Shen Chong? The extra points, the 4 spirit points around it? Okay. Stomach 25. Right now I'm just writing everything down. Okay?
I put liver 14.
Liver 14. I like it. Okay, what else?
I put do 4 and 6.
Do 4 and 6. Interesting. That okay. Anything else? Liver 2. Everybody had those same points? Nothing different? Spleen 10. What else? Anything else? LI4. I like LI4. Why? What else?
You like stomach 36.
Stomach 36. Anybody? Anybody else? Okay, stomach 40. Spleen 6. Okay. So if I was giving you an exam now that you have anybody have any other ideas?
I put gallbladder 34.
Gallbladder 34. All right. It's part of like critical thinking in terms of point selection. So if I say of these, pick only 6 points, right? What 6 points are best for this patient? Okay. Liver 3. I'm going to agree with that, right? That's 1 of 6. Epigastric pain, master point of the Fu organs. I'll go with that. It's an excess condition. It's important. So liver 14 or liver 13, and why? Yeah, okay. So liver 14 is the mu point of the liver. If we do in fact still have hypochondriac pain, so liver 14 we often use for liver overacting on stomach, liver 13 for liver overacting on spleen. Both of them could be used here. I would probably choose one or the other. It's hard for me to say which is best. I would probably choose liver 14 because of the pain and because hypochondriac, the history of hypochondriac pain, and even the epigastric pain, right? Isn't that what it says? Abdominal pain. So we're not quite. So maybe this is really, does it say where the abdominal pain? Abdominal pain. So actually, this is probably lower abdominal pain. It doesn't specify, but based on the wording here in the, so maybe, okay. Most important ones. Come on. All right, so here's an interesting reflection back to the what illness is this? Is the abdominal pain the problem or the constipation here? The constipation. Because when I reread this, abdominal distension and pain remained while discharging, right? Just talking about like basically that he has lower abdominal pain while he's because of the bowel movement and constipation. The assumption being if we resolve that constipation, the abdominal pain will now go away. So I think that the best illness in this case is constipation. Stomach 25, yes, right? Stomach 25 is important, I think, empirical in this case. So we have 3, liver 3, Ren 12, stomach 25, what else? I'm going to say Li4 because it's moving. We have stagnation, right? This is empirical, right? We use it with liver 3 all the time to soothe liver qi. It moves and disperses qi, mildly clears heat, stops pain. Right? What's that? Well, these are for stress. You mean like the mind, calming of the mind. So, yeah, you're saying, should we do 20 or not? Well, so here's just a thought, okay? This is just like a reflection on this. So in clinical practice, I definitely would, right? All patients have, a certain amount of mental and emotional stress and can benefit from that. But here, none of the current signs and symptoms really seem to reflect a lot of stress anymore, except for that there's a wiry pulse, but it doesn't seem like there's a lot of mental and emotional stress currently. But we could add, if it was me, I'd add yin tong instead of do 20. I don't know why, just a preference, I guess, in this case. But it doesn't really matter. But yeah, you could, but I'm just not circling it as being of crucial importance here. Come on, you have 2 more. Which 2 would you add? If I had to pick, I'm going to say stomach 36, yes, in this case. Stomach 36, or could we use something else? Possibly, but we have abdominal pain, constipation, command point of the abdomen. Of these points, could we use stomach 40? Probably. I would not. I don't see any reason to use spleen 10. I don't see any reason to use do 4 or do 6. I'm not sure why you chose that. Gallbladder 34 is kind of interesting here because it does have a function of soothing liver qi, does clear heat a little bit. Does question?
Right, because that directly spleen 10 is chosen in the book of qi stagnation.
Where are you? Yeah, chi and blood stasis. So spleen 10 treats blood stasis in the lower abdomen. I wouldn't. Well, I could use liver 8. I don't think I would use. Sorry, I'm not following this book right now, so I have to look at what it is that you're even looking at. So you're treating abdominal pain, or you're looking up abdominal pain rather than. But under abdominal pain, right? Rather than constipation. Okay, so I would, so lower abdominal pain in the textbook due to blood stasis, I would treat with those points. This is not really that case, right? This is not, there's no blood stasis here for 1. 2 is the pain is probably caused by the constipation, so at the very least, check that chapter.
Again, if you go to abdominal pain, you can be steered a little bit off kilter.
Yeah.
Depending on what symptom you pick.
That's right. Yeah. Yeah. Sandgel 5, triple warmer 5, a Sandgel 6. Can also, is it Sandgel 6 in there? Yeah. Okay. So, this is also commonly used for, I actually like that one, for constipation, Sandgel 6, right? At any rate, I mean, if you could add back shoe points we didn't add. So, if I really wanted to I'd probably get rid of stomach 36 is not that important, and I would add the back shoe points of liver, so UB 18 and UB 25 is large intestine. So there we go. That's a nice basic, liver is the cause. We could add the spleen point if we wanted to, but again, you're getting high up there. LI4, liver 3, stomach 25, those are the first 3 that I would think of. UB 18, UB 25, Ren 12, Sandgel 6. It's a good treatment, right? That would work. The constipation would improve, right? Yeah. 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 I think that's pretty good. Oh, herbs. Well, I already said use a Danja Sharialsan plus. Oh, was that the last case? Sorry, which one? For the manic depression. Okay, hang on a second. Let me check. Gamma Datsao is what was used. I did check. Yeah. It's an interesting question. Spleen, weakness of spleen, that is potentially there. Just give me 1 second here. Treat obesity by inflicting mental stress to the point. Yeah. Okay. All right. So, so a couple other options here for treatment. Stomach 28. Stomach 28 could be used. Yeah. Liu Mo Tang. Yeah. Yeah. Modified Liu Mo Tang. Yeah. Right. So for those of you that don't study herbology, Chinese herbology, you should be aware that most of the Zongfu patterns are rooted in herbal prescriptions. So if you are just an acupuncturist, you may be working, I think I said earlier, the meridian pathologies, musculoskeletal diseases are a large quantity of what, how we're diagnosing and treating and choosing points. When we're looking at internal disorders, we have to understand the use of the herbs, basically. So that's what you're saying, is that we need to, by looking at the herbal prescription, we can understand the diagnosis a little bit better. Okay, so let's go through the next case. So the next one is, let me actually tell you so that you can start doing it here. The next one is the vomiting. Vomiting and fever for 2 days. Okay? Male, 42-year-old technician. Read through it, write down your own. Okay. Are we ready? Does everybody have something written? All right, give me somebody else. Give me your diagnosis. How did you phrase? What did you write? What is the diagnosis? Vomiting due to what? So you said wind cold with damp. Wind cold with damp. Okay. Anybody have something different? Good. So basically the same. Okay, so that might get by too. Again, it's the issue of normally wind cold doesn't cause nausea and vomiting, or do we have? Yeah, we have vomiting. So normally wind cold wouldn't cause it. So if we have wind cold, there's like a formula for wind cold which releases the exterior. It doesn't deal at all with this, right? We have to specify that this has gone into the stomach and is, So yeah, location. This is actually pretty much the spot on. Okay? What's that? Yeah. What? Invading stomach? Invading stomach, yes. Can I ask you why you would include wind there, not just cold, damp? Cold, damp, invading stomach? You could do that too. Wind, because it indicates that it is an exterior pathogen. So we use this term, wind is like a really broad umbrella. There's all type, wind is used a lot, but in this context, wind cold means exterior cold invasion, cold damp invasion. Again, damp phlegm thing. Congestion in his chest. Okay. And why would we dampness and not phlegm? Okay, so the question for those of you online is, so is this dampness or phlegm? Why would this be dampness and not phlegm? Because he has, sorry, I'm just looking for the signs and symptoms, chest depression with epigastric distension, okay? So in this situation, there's a couple of reasons. One is because we don't have the presence of phlegm. Short duration, yeah. So let me go down. Let me go through and break this case down. For those of yeah. So there's a number of reasons why this isn't phlegm, but let me just go through the whole case and break it down quickly. All right. Oh, I'm on the. We're not on the overhead. Sorry about that. See if that works. Are we back on the overhead? Tell me when. So we have got chills and fever, right? So chills and fever, nausea, vomiting, headache, body aches. This clearly shows it's an exterior pathogen. It also shows that it's affecting the spleen and stomach. Oh, it's still not up. Sorry. Why is it not up? Why are we not coming up? Let me try just reconnecting here. There we go. Oh, hey. Maybe it's just a loose wire. There we go. Okay, fever, aversion to cold, nausea. This is important in the diagnosis specifically because their question, why do we say wind? Because this exterior or exterior? It's entering the stomach. It's affecting the organ system, but it is still on the surface of the body, which is why we have chills, fever, and aversion to cold. Okay. Chest depression, epigastric distension is your question around why is this damp and not phlegm. I'm going to come back to that at the end. Abdominal and peri-umbilical pain with dull pain, poor appetite and listlessness. These kind of indicate dampness really and oppression. Slight low fever. Tongue is pale with a thin and white coat. So if I look up phlegm in any textbook, the tongue is swollen with a greasy coat. Okay, that's one thing that would say, oh, this is dampness and not phlegm. Second, phlegm, the tongue, when there's the presence of phlegm, is usually either swollen or with a thicker, sticky coat, right, or greasy coat. I mean, this is what how we would describe it. So the fact that it's a thin white coating it just doesn't support phlegm. The other thing is that when we have cold, it's only, you said it's acute 2 days ago. So phlegm would not cause the pattern. It is, however, possible, this is what I thought, sometimes we get wind, cold, damp, and it obstructs the function of the lung, and we start to generate and produce phlegm. When we get a cold and flu, and we get phlegm production. This can sometimes be like an effect of wind, cold, damp. So, absolutely. But still, if we have these signs and symptoms, we still have to identify that this is wind, cold, damp specifically, rather than phlegm causing the problem. And the phlegm, again, will be like resolved once we resolve wind, cold, damp. We use like ephedra, mahuang in these situations a lot, right? That's right. Body aches. I drill this over and over and over for students when we're doing 8 principles, saying is this interior or exterior? Chills, fever. So if this is a lecture, I would explain why. Chills because our body's defensive energy, our wei qi, is weak, and anytime we get the littlest wind, we feel cold, right? Fever because our body's zheng qi, or our body's immune system, is responding to the pathogen, right? Headache and body aches because, again, the battle between the zheng qi and the xie qi, the body's resistive energy and the pathogen, are on the surface of the body. So we get these, the head is the yang area of the body, right? The yang meridians, all the yang meridians come up here. This is where we kind of, our qi goes to fight the pathogen, right? Chills, fever, body aches, headache, sweating, often because of dysregulation, again, of our wei qi, which controls the opening and closing of pores, and then a floating pulse. All these signs and symptoms are kind of the key signs and symptoms related to exterior, and we have some of those. What would be the difference if it was a type of heat stroke? So I just want, because heat stroke is a different thing. I mean, there's heat stroke and there's wind heat. Wind heat would be a cold and flu that manifests with chills, fever, headache, body ache. Okay? usually with heat signs. So sore throat is a major one, yellow, phlegm, and usually their tongue is red, maybe a red tip or something like that, maybe yellow coating.
Just again, the pattern of phlegm is accompanied by distended epigastric area.
It's true, but does that mean all distended epigastric area is phlegm? No. Yeah. So what's the question? Okay, summer heat. What are the major signs and symptoms of summer heat? The key signature symptom is heaviness, right? Summer heat, we usually have a feeling of heaviness. Dampness and damp heat, summer heat. This group with the dampness, they cause a few signs and symptoms that are similar. One is the feeling of heaviness, so the whole body usually feels heavy. The headache feels like your head is wrapped in a wet towel. We often have digestive disruptions, so that's what's happening here, and that's why dampness instead of just cold, right? Wind, cold, damp, because the damp easily obstructs or affects the stomach-spleen system. We also tend to have thirst with no desire to drink with summer heat. We also have dizziness and cloudy mind. If we go back to that case we did earlier, didn't we do a case, or I guess it was one of the intro cases that we did, where he had like, which one was this? There was one that there was like dizziness. Yeah, the last one, case history 18.1, diarrhea, where you see, a feeling of fullness and distension. Sorry, his head felt muzzy and foggy thinking. His body felt heavy. This is actually kind of, these symptoms are signature for summer heat or damp heat. Okay. Moving on. Where did we go? Here. Okay. So, do we need to talk about anything else in terms of signs and symptoms? Treatment principle. What is your treatment principle?
Get rid of the dampness.
Okay. So release, so that, by saying wind cold, invading stomach, this is exterior. So the question again, directly connecting the diagnosis to the treatment plan and principle. Do we want to release the exterior here? Yes, we do. There's chills, fever. So, say release, we can just say release wind, cold, damp from exterior, right? That's the first, part of it here. The the part that's affecting the stomach, what did you say? Who said belly, stomach, chi, something or other? Subdue, or we could say harmonize. Stomach, descend, rebellious, stomach, chi, something like that. I mean, that's basically all we need to do here. It's actually a simpler case than any of the other ones we've done, right? What points? PC6. Good. I like it. Why? Well, actually, it's empirical points, right? So because the disease is vomiting, right? Even though it's an exterior pattern, like PC6 is one of the best points, like if you look at clinical trials, right? Acupuncture for clinical trials. What most clinical trials or evidence-based acupuncture is going to use PC6 for vomiting, right? That's what they're going to use. So I'm not sure about constipation. C6. And vomiting and nausea, yeah. So, we almost always use this. What else in this case? Okay, run 12. Okay. Yep. Okay, what else? We have run 12, CV12, yeah. 13. Yeah, we could use a couple more points, but like let's keep it simple right now. Only thing I'm going to say here is that we probably want, this is all addressing the vomiting, but we probably do want something to release the exterior here. So LI11 is more for clearing heat. Is there anything else that you can? Gallbladder 20 is for head stuff. Could we use that? Does he have headache? We could probably use that, you know, GB 20, and then I'm going to say UB 12 or something is a wind. You know, this releases the exterior. So something to release the exterior. I may include in this case, I might do fire cupping on the upper back, right? You know, because it's a cold syndrome and it's exterior. This would be a completely appropriate time to utilize cupping on the upper back, specifically fire cupping, warms it up as well, right? So it's an example of using more than just acupuncture, but you know, that's pretty good. That's a good treatment right there. Yeah, sure, you can use UB21. UB21. Good. Perfect. The formula, what formula do you think? So you could probably use a modified Ma Huang Tong, but certainly not by itself because it doesn't treat vomiting, right? So actually the formula that is listed is Huo Xiang Zheng Qi, a modified version, even though it's a little bit more for heat. It will release the exterior and harmonize the stomach, right? Because the herbs in this will harmonize the stomach and release exterior dampness. Huo Xiang Zheng Qi San is a better formula base than Ma Huang Tong. We also don't have, not the right symptoms for Ma Huang Tong. Okay. Microphone check. Okay, I hear you. This is all online. Guide to complete the PLAR process. You know, if you go through, there's a decent amount of information here about what, you know, I'm not sure what else I can, guide you to read. If you haven't read this material, you should read it, and that will familiarize you with the process and what's required. Some specific questions I can't answer. They are left, like, in terms of marking, like, wording on, like, a disease. You know, well, what if we said abdominal pain instead of constipation? I can't really answer whether or not, you know, it depends on the case and it depends on the person marking it. I mean, there's probably, they're going to be standard, so it shouldn't be that ambiguous. It shouldn't be that, like, you know.
There's not only one standard, so that would be one,
Well, again, if
somebody may say yes, somebody may say no. In this case, we have to ask to repeat.
Based on the information that, you know, you're given, there shouldn't be a lot, like, it shouldn't be like a lot of variance, you know, like if you're practicing TCM, if you have a pattern diagnosis that explains the signs and symptoms as well as their manifestation of disease, and you're treating in accordance with that, and you're addressing both the root and the branch, both the cause, you should be fine. Those little concerns of like, it's difficult for me to answer. I can answer on a specific case what I would do, but I can't answer a very broad thing like that. Okay, so let's go on to the next one. Where are we? So, how are we doing on time? 3:45. All right. Yeah. We'll finish these. We got like 3 more to do, so let's try and go a little bit faster. Appearance of unexplained, is this the right case? Is this the next one that I had down? Yeah, that's the next one. So this is the eczema case. Oh. Oh no, I'm sorry. Oh no. Oh. Okay. Okay, and also in all fairness, the name of the file was labeled that, so the people at home had that already. Okay, all right. 33 years old, appearance of unexplained small blisters with oozing on the body, trunk, and forelimbs 10 days prior to treatment. You know, is this herpes zoster? Is this, you know, some other kind of, I don't know, is it poison ivy? Who knows? We don't know yet. Usually it does, that's right. So usually it's one side, usually it's along the nerve, usually it's really painful, but I'm kind of like saying, oh, you know, this is how we think. Keep your mind open a little bit until you have enough information. A dry mouth with desire to drink water, restlessness, insomnia, yellow urine, dry stools. Okay? Examination of the patient. So based on this information, this whole group shows what? Heat, right? It's just straight up heat here. A lot of signs of heat. Examinations showed scattered red papules and small blisters on the lower back, upper limbs and thighs, along with patchy blisters and erosion. So this kind of clarifies that it's definitely not herpes zoster. I mean, you know, that's not the manifestation. So let's just be clear on the disease. Even though I told you it's eczema, we could also, you know, we would, in my mind, if I didn't know it was eczema already, I'd be thinking in my mind, what are the major options here? Well, there's no relation. It doesn't say anything about onset to medication. It doesn't say anything about exposure to any kind of irritant topically. It's not one-sided. It's not painful, so it's not herpes zoster, and it's not manifesting like a fungal infection. So, you know, the best answer in from that perspective, once I think about all these common dermatological conditions that could manifest, eczema is left. It's not psoriasis either. Okay? And then in terms of so from eczema, if I think about eczema, what are the common, because we went over this one, right? This is one of the diseases we talked about. In my mind, what did I say were the main causes, the most common causes? Damp heat or blood deficiency with wind, you know, this kind of deficient type. If I look at the tongue, red tongue, yellow greasy coat, damp heat, right? Look at the pulse, slippery and rapid, also damp heat. Okay. If I look at the lesions, the lesions themselves have oozing with them, which is showing showing dampness, basically. And then obviously we have heat inside the body. So what's the diagnosis? I've already given it to you. Well, eczema due to damp heat. Okay? Good. That's pretty good. Write down your treatment principle and your treatment plan. Go ahead. 2 minutes. I'm just trying to speed it up a little bit. but I want you to practice writing them down on your own. Okay, how do we word with this particular disease, how would you word the treatment principle? Remove, usually we use the term drain damp, because that's how we get it out of the body. So drain damp, clear heat. And what about the eczema? So, just reading through the case here, basically itching, like I could also say that this is damp heat in the skin, right? So sometimes we use this, or wind, wind in the skin or something like damp heat and wind in the skin. This is itching is another form of wind, a different form of wind. So in, oh gosh, how do you describe? Okay, so even in acupuncture point selection, some of the points, like if you look up in Peter Deadman, if you look up the function of a point that is used to treat itching, it will usually, its function will be to clear wind. If you talk about herbs that stop itching, we again are using this term wind to describe the manifestation of itching specifically. So I could use that terminology here, like clear wind from skin to stop itching, or something of this nature. If I was using an herbal prescription, I would certainly do that, right? Oh, well then. Okay, interesting. All right, so then maybe we don't need to do this. Sorry, I wasn't paying attention. Do we need to do anything else? Maybe not. Calm the Shen, calm the mind. Do we have agitation of mind? Not really. Sure, we could maybe, maybe from my perspective, calming, clearing the heat will take care of that. So I don't know if I need to specifically do that here. Yeah, so I don't think there's any specific signs and symptoms related to liver. Yeah, there's no specific signs and symptoms related to liver here. We don't have any specific signs and symptoms related to liver, so we can't really say that, right? Mostly it's just, drain damp, clear heat. Yeah. I don't see, if anything, I would say from the lower jowl. So if I wanted to be real, what's happening here? So if I talk more about the case, the damp heat, where is it? It's manifesting in the lower body. Where is it? Lower back, upper limbs, and upper limbs, and thighs. Okay, so it's lower and upper here. Systemic. I don't think we need to say anything else. We can't identify an organ system here. There's no specific signs and symptoms of an organ system. The heat is because of the interior symptoms. This one here, the symptoms described by patient. Whoops. That's why we're saying heat, right? And the tongue and pulse also show heat. What points? What are the important points here? Li4, why? I'm going to say Li11 is definitely important. This is empirical for damp heat eczema. We use this all the time. What else? Urinary bladder 13. So maybe, this is the lung relationship with the skin, but like when I teach WICA, when I teach dermatology, one of the questions I ask is, because normally we don't, even though the large governing rule is the skin, we usually don't treat the lungs specifically for skin conditions. It's not an important one here. What else is really important for damp heat? Spleen 6, spleen 9. Okay. See, in this case, I would use GB34, which clears damp heat, has some effect on the gallbladder. Spleen 9, you can add. And then what would I use? I maybe even do 14 to clear heat strongly, or as opposed to UB11 or 13, you said here, do 14 is stronger for clearing heat, or GB31. It's often commonly used for itching. Oh yeah, no itching. Okay, sorry. It's just strange to have weeping eczema on the limbs and torso without itching. So yeah, we could use these. I like these. I think these are more important in this case. What did you say? Stomach 36, I probably wouldn't here, but the heart 7 is maybe a little bit more interesting because of the insomnia and this kind of agitation. It's understanding why, even in the book, the book is not like, it's not what every TCM practitioner uses. It's like, why are we using heart 7? Because people that have agitation like this often have insomnia. So yeah. And what else was the other one? Spleen 6. Spleen 6 is probably good for the dampness. Okay. That's good. Okay, so this is not a cold and flu. The manifestation is still on the surface of the body. So remember the little outline I gave you, I kind of said right at the end, where's the location? Is it in the meridians or in an organ or skin, muscle, tendon? We could call this a manifestations in the skin level. It's a skin condition. The reason that's important is because the herbs, so the herbs that we commonly use to treat this kind of a pattern are, they're the same group of herbs that are used for colds and flus, and they go to the surface of the body. So we often, the manifestation is in the surface of the body. However, the damp heat is interior. Yeah, but you'll notice, like I said, I guess I didn't write it down, but I was mentioning like do 14 or something would be also an exterior releasing point, but yeah. What's the medicine? So from my perspective, there's, normally what do we use for eczema due to damp heat? What's the standard formula? Okay, this is a clear heat. Well, in my mind, I was thinking Xiaofengsan. Xiaofengsan we use. Yeah, we use that a lot. I mean, that would be appropriate, I think, in this case, right? Yeah, or something, because there is a lot of heat, some kind of modified like Longdan Shigantang we could use. That's also for a strong interior heat and damp heat. So Longdan Shigantang doesn't actually address the eczema, but we could maybe modify add the few herbs or mix Xiaofengsan with Longdan Shigantang. Do you want me to write that down? Do you need me to write that down? No. Okay. Sorry, what's the question? I have to repeat it. Yeah.
There's extra points in here. You said are probably not the best points. We're not going to really have the best points because every case not going to reflect exactly what they're expecting.
Right. So yeah.
The best approach would be to write everything out and then try to limit.
So the best approach I would say would be to always start from the closest pattern you can find. That's the starting point. So we have WHO coded TCM diagnostic patterns, right? ICD-11 codes we have, right? We have these, it's really quite standardized. 9 times out of 10, you'll be able to choose the pattern that's there, right? I mean, you'll be able to find one that's there 9 times out of 10. After that, once you get to that point, then you can, if you feel like it doesn't really fully match, or if you don't understand why, like in the case, in the example in the text, why are they using Heart 7? I don't really know. I don't know. Maybe you replace it with something else that you think maybe is, like I said in the beginning, assume that you have to explain why you're choosing the points, and then you'll have a reason behind it. And if you're only doing 6 cases in 3 hours, there's 3 cases in 3 hours. I mean, I don't understand why you wouldn't explain the points in that case, Yeah, right. Okay? There's no stupid questions.
What would be wrong with writing down the reference?
Sorry?
So, some of what you've given us here, I found directly here. What would be wrong at the end of your question, at the end of your answer, to write down the page and the reference where you go through or answer something?
I don't see any reason. I don't see any reason not to do that. I mean, I don't see, they don't say not to do that. So you'd be giving them something to, hey, this is where I got this answer from. It's an open note test, so here's my reference. They're saying that it's open notes. They're saying you can bring a book, then why not?
Wouldn't hurt in any way, I don't think.
I don't think it would.
They figure you don't know this stuff, you just wrote it down from the book.
Yeah, but
Maybe it works against you, I don't know. It's hard to read.
well, I wouldn't think that if I was great. I mean, they can't write it again. They're saying it's open notes, so they can't hold that against you. That you're choosing the best answer based on that, and if it's appropriate, then sure. The more challenging thing is if it only matches part way, then
You're not going to find it exactly.
Yeah.
You found something to support the points you've chosen and things of that nature.
Sure.
Probably wouldn't be a bad idea if you wrote that and you left. In case there's a discrepancy, you could say, I used such and
Mark
such.
it down.
There's nothing wrong with writing a note to yourself saying, for question number 1, I used these 2 references. And
Sure.
number, you keep that just in case there is some discrepancy between you and the marker.
Sure.
At a later date.
Sure. Yeah. So I think that's a good idea. But so for those of you online, if you didn't hear that, we're talking about recording. If you reference something, if you find something in a pattern, record what book and page number it was on, so that you have that for a later date in case you needed to dispute the results or something. Okay. All right. Moving on. Next case. Polydipsia, polyphagia, polyuria for 3 years. Go ahead, read through, write down your illness, syndrome differentiation. I'm going to say at least for now, for the last two, because I only have two more that are pulled up right here, practice writing down your reason for your diagnosis this time as well. Okay, so, this idea of like, what I did in the beginning, which is circle and indicate. So group your symptoms together, group your patterns together when you see, several signs and symptoms that indicate a pattern. How's everybody? Did everybody get their treatments laid out? What's the TCM diagnosis? Well, what's the disease? What's the illness? What's the syndrome? Does everybody get that? We didn't give it away in the beginning. What is that in TCM? Yeah, so we call Xiaoke, which is consumptive disease. Okay, diabetes. So we would certainly be expected to identify that based on what's presented, even if you had less information here. Those of you that are less familiar with, biomedicine, you would be expected to identify that this was diabetes. What's the TCM pattern here? You said kidney. I'm not sure, right? Kidney yin deficiency and blood stagnation. Where's the? Well, let's just start with kidney yin deficiency. Anybody have something other than kidney yin deficiency?
Look here, it says yin deficiency and dry heat involving the lungs, stomach, and kidneys, depending on the jiao, whether it's upper, middle, or lower.
So can you identify that in this case? Is it more upper, middle, or lower?
Identify symptoms of all three.
Okay.
Emaciation has to do with one jiao. The pale tongue has to deal with another jiao. As I say, it was a bit of a guessing game because all the symptoms can be grouped into three, according to the book here, according to the symptoms that the book describes, page 61, he has symptoms from all three, which makes it very difficult sometimes, I guess, to know exactly what organ's involved.
Okay.
That might be change my mind about this both yin and yang.
So you think there's a yang deficiency too?
Well, yeah, that leads on. It says both the yin and yang deficiency.
Okay. Dark pale tongue. Okay.
So there's actually three jiaos plus the yin and yang deficiency. There's four then.
So what is the most appropriate diagnosis? Like, for the purpose of today, since, we don't have a whole lot of time to, the question is how do you best write down a diagnosis? For those of you that are listening online, basically we're just going back and forth saying, well, there's signs and symptoms of all three jiao. Is this yin or yin and yang or yin and dryness? I mean, if I'm kind of objectively looking at this, do we focus if the symptoms are in all three jiao equally, we don't need to focus on one particular jiao. So we may not need to indicate that. If we're going to focus our treatment in one area, we probably do want to indicate that. But here, we maybe don't, right? The thirst and the spontaneous perspiration. Spontaneous perspiration is really the main one here, yeah. Yeah, and so the dry mouth thirst, could be stomach, yeah. And then we have the lower jiao symptoms, so, it's fair enough. Well, that's what I'm saying, is we don't necessarily need to choose a jiao in this case. Well, are you going to treat something else? So You know, I'll tell you the few problems I have with kidney yin deficiency specifically. Kidney yin deficiency as a pattern should have what signs and symptoms? Night sweats, hot flashes, lower back, red tongue, peeled coating is kind of key sign and symptom. And yet here we have spontaneous perspiration, which really is more of a lung deficiency pattern. General, yeah. We do have. Yeah, milky turbid and sweet urine. I don't know if it's milky turbid, but it's definitely sweet based on his test. Okay. Weakness, restlessness, dry mouth, dry lips. So all of this, but all of this is still yin deficiency. So all of this is yin deficiency. But my point being is that you are not explaining everything. If you just say kidney yin deficiency, right? And so you're not at why would the tongue be pale and dark if it's kidney yin deficiency? Why would he have spontaneous sweating if it's kidney yin deficiency? Why would the pulse be deep and wiry if it's kidney yin deficiency? So I guess that's my issue here. I mean, if I think about treatment, and this is not uncommon, I'm still going to work with the kidneys. I'm just saying you may, in this situation, want to keep it to, more general if you don't have it. Yin deficiency and dryness, a little bit more systemic, basically, or we could say of all three jiao if we wanted to, because 3 jiao, not 3 organs. Sorry? Yeah, yin and yang deficiency. Sorry? Not every case, because if it's specific, it's specific. If it's not specific, it's not specific. So in this situation, the question is, do we have yin and yang deficiency or not? Okay. Okay, so tell me why.
Because I can't make sense of the deep and the
yes.
pale dark tongue.
And there's 2 other symptoms. Deep pulse, pale dark tongue. Yeah, there's one more specifically that's directly connected to the yang of the body, which is the spontaneous sweating. Wei qi pertains to yang, so we often, while it is also a symptom of lung qi deficiency, we often look at this. It can also be connected to yang deficiency. So, based on the patterns in the book that we have, that's probably the most appropriate one. Okay. So, deep pulse, pale dark tongue, and spontaneous sweat can all indicate a little bit of yang deficiency. I actually am gonna say that this is more of a qi and yin deficiency from my perspective. So qi, and I don't know if you even have that in your notes, but the reason is because if I tonify yang, I'm going to generate more heat. And that's going to cause this person more problems because there's a good amount of dryness in the body, and we need to be a little bit careful with that. So deficiency of qi and yin. Qi and yin. I'll actually write down here. Deficiency of qi and yin injuring fluids is that's the way to write this one. Dry mouth, thirst with desire to drink, lassitude, right? Low energy. Emaciated. This is another something that we should consider related to yin. Emaciated would be, this maybe it has to do with the spleen nourishing the muscles, but really it's just the somebody whose yin is depleted systemically, somebody who's like real thin.
That's not the coating is yellow on the tongue?
Where is the tongue here? Tongue is this the same one? No, sorry. It's the next one. Where is the tongue here? I'm having a hard time seeing it. Oh, dark here. Dark pale tongue with white coating. So a pale, I would say, I would usually call this like dim. I mean, dark would indicate that something is stagnant. I didn't write these cases, so I actually have his answers here. No, pale, dark would mean stagnant and white, right? I mean, dark would indicate stagnation. It would be like, well, I mean, you're talking about the tongue body, so really it means like, we use the term dim often. Dim means like pale and slightly bluish purplish is really what it means. Dark, it's like stagnant. So, in all fairness, with combination of that, you're right. That deep, wiry, rapid pulse. So, can I see your book for a second? The one, or somebody read me the signs and symptoms of yin and yang deficiency. Sounds pretty close here. Okay, I'm going to stick to what I said then, which also matches what he had, which is qi and yin damaging fluids, because there are no cold signs and symptoms here, right? There's no cold signs and symptoms, right? Because even though a deep pulse and what was the other sign that we had? Deep pulse and the dark pale tongue indicate, like, would match a yin and yang deficiency. Those would indicate yang deficiency. Because there's so much dryness and because we need to nourish, and I'll say that and the pulse is rapid, I would not want to tonify yang. I'd have to be really careful. It's not as big of a deal for acupuncture because acupuncture does not have the same strong effect inside. You could do heat therapy and it's not going to cause the person bad, but if you give this patient warming herbs, it will cause them harm. So, keep that in mind.
Can you explain to me why there would be a deep wiry pulse here?
It's hard for me to say. In a nutshell, without what? Without yang? Without liver involvement? Yeah. So all I can do is speculate because I don't see the patient. What happens when the pulse is deep with yang deficiency? Why is the pulse deep? Because there's not enough yang qi to move qi up and out, right? Yang moves up and out. So when we have a yang qi deficiency, the pulse is deep and it stays deep. We have to seek for it. The other thing that happens when we see deep pulses is we see constraint inside. So cases like I think one of the cases that was like a stagnation, constipation, I forget which one it was. the patient had a deep, wiry pulse when there's pain and constriction deep in the body. So in this situation, it's possible that there's the beginning of a yang deficiency, or that that there's some other pattern. There's some other pattern that's present in his body. I mean, it's like, patients may manifest like this. I can't answer that question in a very concise way based on the information that I'm given.
Speaking on my own behalf, I doubt very much whether I'd write that down
Yeah.
for an exam.
Yeah.
You just said a stomach, lung, and kidney deficiency. Because they say
That's probably fine.
the general pathogenesis is a yin deficiency of the stomach, lung, and kidney.
So for those of you online, if you wrote down stomach, kidney, and lung yin deficiency, would that be okay? So, and I'm saying, well, it's probably fine, and I'm going to explain why when I go through the points. So, point selection for this case, because of time, I'm just going to actually go through what he has and put it up on the board. So, Wei Guan Xia Shu. Wei Guan Xia Shu is an extra point, EXB3. Where's my marker here? So this is a special point for diabetes. Wei Guan Xia Shu, EXB, B3. Okay. He uses UB13, 20, 23. Spleen 6, kidney 3. Kidney 7. Do 4, Ren 3. Okay? So the question of like would if I was looking at it and you said lung, kidney, and stomach yin deficiency, and then I look at these points, right? Lung, spleen, maybe you want to say spleen and stomach yin deficiency, kidney, spleen, kidney, urination, frequent urination. So do 4 is more for yin. Well, yin, it can be used either way. So yang deficiency, yes, but it also can be used to clear heat. Ren 3 is the urinary bladder because the symptoms, it seems like significant symptoms of the urinary, urination, right? And it also does serve to nourish yin a little bit. The formula is modified Shenmai San and Zhengyi Tang. Shenmai San, Zhengyi Tang. So this is where his diagnosis as it was written down, and this matches. It's not a yang tonifying, right? I'm not familiar with this formula. Xiaoke Wang. What do you know what's in it? Read me the herbs. What herbs are in it? Do you know? Keep going. Tianhuafen, Huaqing. That's it? Just 3 herb? Shengdi, Maidong, Beixiashen, Tianmendong, Zhimu, Tianhuafen, Huayuan, Huangqing, Gegen. So you could use that, but most of this is very, very similar to this, right? Most of the herbs are the same, just a little different. So it's fine. Xiaoke Wan, right? It's a Xiaoke syndrome, diabetes pill, Xiaoke Wan, diabetes pill. Okay? What is the treatment principle is to tonify qi, nourish yin, generate fluids. clear heat a little bit, possibly. Sorry? Repeat. Tonify qi, nourish yin, clear heat, generate fluids. There's I can think of other points that I would choose in this kind of a case. For example, lung 7. Lung 7 is the master point for the renmai, so it's important for tonifying yin. It also has a benefit on the lung, generates fluids in the body. We may want to do Ren 22, 23. Ren 23 is also to generate fluids, or Jia Chenjiang, Jia Chenjiang. Extra points also generate fluids, basically for excessive thirst. These are other points that we may choose. I'm more concerned about yin generating fluids and clearing heat myself. It's not excessive heat, really, right? Okay. One more, and I'm just going to go through this one quickly because we're getting short on time. So, female, aged 42, staff, married, chief complaint, diarrhea during menstruation. Okay. What is the disease? Diarrhea, probably. Let's read the whole case first. History, bowel movement, moved regularly, except that during her menstrual period she suffers from loose or even watery bowel movements. Okay, in my mind, what does that indicate? Well, it indicates that there may be a kidney issue. If kidneys regulate menstruation, maybe a liver issue. Liver, what has a role in menstrual cycle? What would affect the bowel movements during menstrual cycles? If it's watery and there's no pain, maybe there's some kind of deficiency. Thirst, urgent urination, right? Thirst to me means a little bit of heat. Urgent urination, maybe that could be a couple of things, actually. It's hard for me to say for sure right now. Insomnia or sleeping with many dreams, that to me looks like a heart pattern. It's likely heart yin deficiency or blood deficiency, okay? Or it could be heart heat, because there's also thirst for drinking. So in my mind, I'm leaning towards yin deficiency or heart heat here so far. Perceiving heaviness sensation of the two legs comparable to lead. Interesting. So this could be dampness, it could be a kidney weakness, it could be a circulation problem, similar to the first one of the earlier cases we did. Profuse menses with blood clots. Okay, we don't have a whole lot of information here. It doesn't say that the blood clots are purple, which would indicate blood stagnation. So it doesn't say that, so I don't want to make that assumption. If it's profuse menses, it is likely connected to either a kidney deficiency or spleen deficiency. Okay. The tongue is red with a white coating. Pulse is wiry and thin. So based on that information, a fine pulse or yin deficiency. A wiry pulse indicates liver involvement, doesn't it? So based only on the information we have, what is the best option? What is there's not a whole lot of information here. So what is the best diagnosis based on what we have?